Hapa Ciheb-Kenya hakuna matata.
Innovation tamu sana,
hakuna matata.
Tukiwa inclusivity,
hakuna matata.
Ndani ya Pan-Afri,
hakuna matata.
Nyote wakaribishwa,
hakuna matata.
Na Ciheb-Kenya
hakuna matata.
Lop, 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 lop.
Jambo,
Jambo.
Wakaribi
Ima jambo,
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 jambo bwana.
Habari gani wewe?
Mzuri sana.
Wageni nyote wakaribishwa.
Ciheb-Kenya hakuna matata.
And the round of applause is in order. Thank you very much, ladies. This Fiesta Milele. We are here to entertain you for this launch dinner, and we welcome you officially as you enjoy some oldies, gospel music, and all over the world. Enjoy. Down the way when the nights are gay and the sun shines daily on the mountain top, I took a trip on a sailing ship, and when I reached Jamaica, I made a stop around.
Sad to say I'm on my way, won't be back for many a day. My heart is down, my head is turning around. I had to leave a little girl in Kingston town.
But I'm
sad to say I'm on my way, won't be back for many a day. My heart is down, my head is turning around. I had to leave a little girl in Kingston town.
Down at the market, you can hear ladies cry out while on their heads they bear ackee rice, salt, fish and ice, and the rum is fine any time I hear. But I'm
sad to say I'm on my way, won't be back for many a day. My heart is down, my head is turning around. I had to leave a little girl in Kingston town.
But I'm
sad to say I'm on my way, won't be back for many a day. My heart is down, my head is turning around. I had to leave a little girl in Kingston town. Oh, hiya, oh, hiya, oh, hiya, la 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 la, sing to hiya, oh, hiya, oh, hiya, oh, hiya, la 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 la.
Every time you think me lies on,
Water comes to me eyes.
every time me thinks
Every
me
time
lies on,
Water comes to me eyes.
every time I think of baby,
Water comes to me eyes.
every time now.
Water comes to me eyes.
sing along,
Come back, Liza, come back, girl. Wipe my tears from me eyes. Come back, Liza, come back, girl. Wipe my tears from me eyes.
sing along.
Come back, Liza, come back, girl. Wipe my tears from me eyes. Come back, Liza, come back, girl. Wipe the tears from me eyes.
Every time I'm having dinner,
Water comes to me eyes.
every time I'm at Pan-Afri,
Water comes to me eyes.
sing along.
Come back, Liza, come back, girl. Wipe tears from me eyes. Come back, Liza, come back, girl. Wipe my tears from me eyes.
Sing along.
Come back, Liza, come back, girl. Wipe my tears from me eyes.
Tell me, I say,
Come back, Liza, come back, girl. Wipe my tears from me eyes.
Naebaki suka sekoti ngamai yangai na mubali nangai pantalo mukaba mama tobalana kosuki sabilo bela kuyabato likwela yangai na sheri sukalili tama naebaki suka sekoti ngamai yangai na mobali nangai pantalo mukaba mama tobalana kosuki sabilo bela kwea bato likwela yangai na sheri sukalili tama nayebi kombo ya bandate oyanganda yaho libala goya bombandate aye nayebi kombo ya bandate oyanganda yaho libala koya bombandate ae majengo siendi tena majengo siendi tena majengo siendi tena kuna tambo za mitego majengo siendi tena majengo siendi tena majengo siendi tena kuna tambo za mitego na moyo wangu wanituma vyema mimi niwe mwanachama wa daima na sitaweza kuliacha rumba ila moyo kunituma moyo wangu wanituma vyema niwe mwanachama wa daima na sitaweza kuliacha rumba ila moyo kunituma harambe 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 tulicheze rumba harambe we harambe 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 tulicheze rumba na Ciheb na visi tena Ciheb na visi tena Ciheb na visi tena kuna co-values zamana Ciheb na visi tena Ciheb na visi tena Ciheb na visi tena kuna mshahara kubwa moyo tena Ciheb na visi tena Ciheb na tutoki ya kwa nini kuna promoshoni mingi moyo wangu wanituma vyema ati niwe mwanachama wa daima na sitaweza kuliacha rumba ila moyo kunituma moyo wangu wanituma vyema niwe mwanachama wa daima na sitaweza kuliacha rumba ila moyo kunituma harambe 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 we harambe tulicheze rumba harambe 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 harambe
tucheze rumba.
Barua kwa mpenzi wangu Gaston, na picha yako ulonitumia iko kwa kichwa cha kitanda changu. Wewe baba,
Oh Baba Gaston,
barua kwa mpenzi wangu Gaston, na picha yako ulonitumia iko kwa kichwa cha kitanda changu.
oh Baba Gaston,
Baba Gaston asemaje?
oh Baba Gaston,
Baba Gaston ni mwimbaji.
oh Baba Gaston,
usiku nao siwezi kulala nikikumbuka mapenzi yetu. Ninaota kama maua tu.
oh Baba Gaston,
usiku nao siwezi kulala nikikumbuka mapenzi yetu. Ninaota kama maua tu.
oh Baba Gaston,
Baba Gaston mwimbaji kama meso. Oh Baba Gaston, Baba Gaston asemaje? Oh Baba Gaston.
Hata makofi ya macho. Makofi tu ni kitu ya kunyima mtu. If you can hear and see us, please wave us in the air. Kama unatuona na kunisikia, tupungie mkono juu ya hewa, mpatie jirani yako high five. Utaosha mkono, tumpatie high five. Look at your neighbor. Angalia, confirm if that is a human being next to you. Angalia kama ni mtu. Mwambie welcome to the dinner, launch dinner. Mwambie welcome to the Ciheb-Kenya dinner, launch dinner. Mwakaribishe hapa. Sisi tuko hapa kwa sababu tunapenda kutumbukiza watu, and we are here to entertain you. We take you to begin. We bring greetings from South Africa.
The Bible tells us that we should repent our sins and see the light of God. Oh, amazing grace, how sweet sound. We shall see the light indeed.
amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see.
Amazing grace, how sweet the sound that saved a wreck like me. I once was lost, but now I'm found. Was blind, but now I see.
I see.
The one. I can see,
I see,
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 brothers and sisters,
I
can see,
I see,
truly brothers,
I see,
I can see,
I see,
I was blind,
I see,
I can see now,
I see,
I can see,
I see,
I can see,
I see,
I've lived in darkness,
I see,
but now I can see,
I see,
hallelujah,
I see, I see, I see,
I can see,
I see,
I can see,
I see,
I can see,
I see,
I can see.
I see.
I've lived in denial, but now I see.
I see.
I've lived in shame,
see.
till Jesus found
I
me.
see.
Hallelujah.
I see. I see.
Waro, 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 wamesia, 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 waro, 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 wamesia, Wamesia, I can see, I can see, I can see, I can see, Waro, 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 Wamesia, Wamesia, Walla, 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 la 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 la. Edson, Waro, Waro, Wamesia, Wamesia, Walla, 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 Walla,
Yes, upige makofi. Hakuna haja upige makofi kama umepocket. If you want to clap, just clap for us. Sisi kazi yetu ni kuimba, tulishindwa kusoma. Sasa tukaona kazi yetu tunakuja kwa watu ambao wamesoma, tunawaimbia. Bule mwenye amesoma kidogo hapo ako na PhD hapa kwetu, tukashindwa kuendelea hapo, tukaanza kuimba. We take it to South Africa, we bring you greetings. We say Dumela.
Abantwana, Kosi and Kosi.
Dumela, Kaufela, Dumela, Ria, Dumela, Kaufela, Omonsio Ajayo, Dumela, Kaufela, Dumela, Ria, Dumela, Kaufela, Omonsio Ajayo. Marching to Zion. We are going to the city. Oh, we are marching to Zion, the city of the Lord. And we are marching to Zion. We are going to the city. We are marching to Zion, the city of the Lord. Dumela, Kaufela, Dumela, Ria, Dumela, Kaufela, Omunzio Anyayo. Dumela, Kaufela, Dumela, Ria, Dumela, Kaufela, Omunzio Anyayo.
Soman limpilo yetu bao. Kosi and Kosi.
Marching to Zion. We are going to the city. Oh, we are marching to Zion, the city of the Lord. And we are marching to Zion. We are going to the city. Oh, we are marching to Zion, the city of the Lord. Dumela, Kaufela, Dumela, Ria, Dumela, Kaufela, Omunzio Anyayo. We are marching, Kaufela, we are going, Dumela, Ria, Jerusalem, Kaufela,
Jerusalema, omuzi omanyayo.
Jerusalema,
Jerusalema, Jerusalema, omuzi omanyayo.
Jerusalema, 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 umuzi omanyayo. Jerusalema, Jerusalem, Jerusalem, umuzi omanyayo. Siyakuthandazela. Jerusalema, Jerusalema, umuzi omanyayo. Siyakuthandazela. Umuzi omanyayo. Tumela, 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 kaufela. Umuzi omanyayo. We are marching, we are going. Jerusalem, umuzi omanyayo. Woza, 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 woza.
Watu wa Central pia umefikiwa ado ya nyoba. Haya.
Julieta, Julieta, uko wapi? Julieta, Julieta, uko wapi?
Wanasema muziki bila jasho. Haya.
Julieta, Julieta, uko wapi? Julieta, Julieta, uko wapi? Tangu tuliachana nawe mwaka uliopita, uko wapi? Uko wapi? Tangu tuliachana nawe mwaka uliopita, uko wapi? Uko wapi? Julieta mama. Ukampata mwalimu wa kizungu, kizungu. Ukampata mwalimu wa kizungu, kizungu. Hae, hae. Julieta, Julieta, uko wapi? Julieta, Julieta, uko wapi? Pararam, 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 Yule mwalimu akakufukuza tabia yako mbaya, tabia mbaya. Yule mwalimu akakufukuza tabia yako mbaya, tabia mbaya.
Kama MC hapo nake.
Julieta, Julieta, uko wapi? Julieta, Julieta, uko wapi? Julieta.
Fulawaya.
Hey, Julieta mama, uko wapi? Ah, Julieta, njoo kwangu, tufunge ndoa. Hewe Julieta, tuishi pamoja. Ah, Julieta, uko wapi?
Hapo nake. Sio tabia mbaya utawacha.
Julieta mama, 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 Julieta mama.
Thank you, asante sana.
We take you to DRC. A rendition by Mr. Milele, originally done by Franco Luambo Liamo Macchiari. Luanzo.
Jaber mangeo, Jaber koadam, koada kodiaga, bene angeo nadwaro monda ng'e. Kar chunyi ni kure mondo wabedi kaparo. Chunya pod medo gombi anyar Kisumu. Kaoaga kwa mwenda wa ngoro, ngoro ya kwa yodhe, kotile nyedete, haya haya haya. Dokana nie dagodhaida oina mandokana nie.
Toko kiko lobao, toko kiko yemba, toko kiko somba, wewe na anza.
Yanza, iwe moyanze, wenyanga hole. Iwe moyanza, wenyanga uze ube uwanje. Iye dagodhaida oina mandokana nie. Please. Yanza ibe wanje omuhano munolu wanje yanza ibe la yanza ibe wanje.
Nene okangeo, nyakane warumo.
Shiro
Okete homwe, nowe wako watene. Kendere ikwane asha. Okete homwe, nowe wako watene.
Nena azda, kombo ya sika.
Berne echunya, berne echunya, okeze.
Adamu yanza
Mwana wanje,
yanza
mwana wanje.
hapo nake.
Malaika, nakupenda malaika. Malaika, nakupenda malaika. Nami nifanyeje kijana mwenzio? Nashindwa na mali sina we, ningekuoa malaika. Nashindwa na mali sina we, ningekuoa malaika. Pesa zasumbua roho yangu. Pesa zasumbua roho yangu.
nilege, nami nifanyeje? Kijana mwenzio, nashindwa na mali sina we, ningekuwa wa malaika. Nashindwa na mali sina we, ningekuwa wa malaika. Ningekuwa wa malaika. Ningekuwa wa malaika. Ningekuwa wa malaika. Mama akina Sofia, mwambie Sofia wangu, naye atange vile na milele na milele. Mama akina Sofia, mwambie Sofia wangu, naye atange vile na milele na milele. Santae kakae, mwambie yule wangu, naye atange vile na milele na milele. Mamae, mwambie yule wangu, naye atange vile na milele na milele. Semaji walisema na masemo yao yote hayakuwa sawa kweli, na milele na milele. Kakae, dadae, mwambie yule wangu, naye atange vile na milele na milele. Punda alinyimwa pembe, akapewa masikio, akapewa na mlio wa milele na milele. Punda alinyimwa pembe, akapewa masikio, akapewa na mlio wa milele na milele. Kakae, dadae, mwambie yule wangu, naye atange vile na milele na milele. Mamae, mwambie yule wangu, naye atange vile na milele na milele na milele na milele na milele na milele
Wanapata mambo yao.
na milele na milele na milele na milele na milele na milele. Sijauona mpilipili na maua yake mchikicho. 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 Na maua yake mchikicho, we mchikicho. Na maua yake mchikicho, we mchikicho. Sijauona mpilipili na maua yake 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 mchikicho. Na maua yake mchikicho, we mchikicho. Na maua yake mchikicho, we mchikicho. Leo ni leo, leo ni leo, leo ni leo, leo ni leo. Teremuka bonde kwa bonde na magendo ukosekana. Teremuka bonde kwa bonde na magendo ukosekana. Teremuka
Thank you very much. This is Fiesta Milele. Thank you for the round of applause. We appreciate. Thank you very much. Kama uko na request, hata DJ yako pale atakuwa anacheza request yako. We're going to have a party tonight. Thank you. Mali Saviti. Mali Saviti. Nagegigogu. Nagegigogu. Tugun. Nyon. Gebe. Momingala. Tugun.
Omuntu labo kyokero tektucho Kiboy tuhul en ekanoy nenyon Eron kinechi labo kyokero mokchero Eron kinechi
Woyo. Kwanta.
Maningala.
Anyone.
Omuntu labo kyokero tektucho Kiboy tuhul en ekanoy nenyon Eron kinechi labo kyokero mokchero Eron kinechi
Achomin. Tugun.
Kongo inguno kimoche chomet net yekalie Kongo inguno kimoche chomet net yekalie Kongo inguno kimoche chomet net yekalie Kongo inguno kimoche chomet net yekalie
Wadidala.
Mali Saviti.
Sweet. Marisa. Marisa.
Kiso iseptele nyon Imerurere nyon Kiso iseptele nyon Imerurere nyon
Marisa.
Kiso iseptele nyon Imerurere nyon 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 Lelo, tingerera ni lelo Tingerera ni lelo Tingerera ni lelo Tingerera ni lelo Kapi moro longisa Tingerera ni lelo Hola leyo ho ho Hola leyo ho ho
Mwagui.
Hola leyo ho ho Hola leyo ho ho Hola leyo ho ho Hola leyo ho ho Kerom tinechi Kerom tinechi Kerom tinechi Hola leyo ho ho 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 Kerom tinechi Kerom tinechi Kerom tinechi
Thank you. That's a piece from the Rift Valley. Now we take you the Southern Nyanza. We bring you.
tungni moro morna,
Emane, Emane olorna anyakalaga.
tungni moro luonga,
Emane, Emane olorna anyakalaga. Nyakalaga, nyakalaga, anyakalaga.
oh morna,
Nyakalaga, 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 nyakalaga.
iri kasandora rumo,
Romna, Cassandra, Romna, nyakalaga.
abiro iri kachoda choda,
Romna,
eh,
abiro iri kachoda choda. Romna, nyakalaga.
abiro iri kawera wera,
Romna, abiro iri kawera wera. Romna, nyakalaga.
abiro iri kagumba gumba,
Abiro iri kagumba gumba. Romna, nyakalaga. Nyakalaga, nyakalaga, nyakalaga.
oh morna,
Nyakalaga,
ololo,
nyakalaga,
olonga,
nyakalaga, nyakalaga.
polong, 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 Yesu. Ogonya Nyasaye nyakalaga, Nyasaye meneno madongo gi matindo, wakwayi wenwa, wan jogi, ai. Atiyo ne Ruodha, atiyo ne ngimana, atiyo ne Ruodha, atiyo ne ngimana,
Jawar Yesu ohera,
ohera,
orito ngimana. Jawar Yesu
ohero
ohera,
waduto,
orito ngimana. Atiyo ne Ruodha,
anachiwa,
atiyo ne
ngimana duto,
anachiwa,
anachiwa,
atiyo ne ngimana. Jawar Yesu ohera,
ohera,
orito ngimana. Jawar Yesu
ohero
ohera,
waduto,
orito ngimana. Jawar Yesu ohera,
ohera,
orito ngimana. Jawar Yesu ohera,
ohera,
orito ngimana.
tinga malo Yesu Ruodha,
Tinga malo byanekana,
tinga malo Yesu Ruodha,
tinga malo byanekana,
tinga malo Jakayuda,
tinga malo byanekana,
tinga malo Wakayuda,
tinga malo byanekana,
tinga malo Wod Mary,
tinga malo byanekana,
tinga malo Wakayuda,
tinga malo byanekana.
Aviane,
Ana molomba, ana musiki,
Aviane,
ana molomba, ana musana
Ibamba,
ana molomba, ana musana
Waduto,
ana molomba, ana musana.
Setete, Achiwaduto,
Tete, achiwaduto,
Setete, Achiwaduto,
tete, achiwaduto,
Setete, Aweyoduto,
tete, aweyoduto,
Setete, Aweyoduto,
tete, aweyoduto,
Setete, Towandu Benda Weyo,
tete, aweyoduto,
Setete, Tondo Benda
tete,
Weyo,
aweyoduto, tete. Agendo polo, nalamara,
Si Ageno Polo,
agendo polo,
Ageno Polo,
agendo polo, nalamara, agendo polo, nalamara,
Ageno,
agendo polo,
Ageno,
nalamara, agendo polo, nalamara,
Ageno Polo,
agendo polo,
Ageno
nalamara, agendo polo, nalamara.
Setete, Achiwaduto,
Tete, achiwaduto,
Setete, Achiwaduto,
tete, achiwaduto,
Setete, Towandu Benda Weyo,
aweyoduto, tete,
Tondo Benda Weyo,
aweyoduto, tete,
Towandu Benda Weyo,
aweyoduto, tete,
Tondo Benda Weyo,
aweyoduto.
Ageno pulo dalam rahuma.
Thank you, thank you. We do one more, and then we take a break. It has been 60 minutes of your time, and then we take a break. We start the program officially. We do one more, then we start. Thank you, DJ. Regan kwa interlude.
Ngado isinda situma Oli wakwa Niondoa shamanene Oligele Urotoro kumagio Eleshore Niondoa okaruaku Emmanuel Ngado isinda situma Oli wakwa Niondoa shamanene Oligele Urotoro kumagio Eleshore Niondoa okaruaku Emmanuel Amokera mokesho Kamosha kwa Umoni ninde wakwa Emonete Wemwega wemwega tia Kamaraya Rewo mole narosho Ingosho Itina nihonene Shangaraya Remwenge getigera Shangaraya Rohoria wakeire
Origo, aponake, ikienda, All right. Thank you very much. Wapi makofi ya Fiesta Milele. Wapi Makofi, thank you very much. We take a very short break as we invite the MC to start the official program. We have been here for the last 60 minutes and we have enjoyed. Let's appreciate our master of ceremonies for today. They have told me that they have both masters in ceremonies.
Hello, hello.
Good evening, good evening.
Hello, hello. Kama unasikia sauti yangu inua mkono please. If you can hear my voice, lift your hand up. Your right hand. Good. Good. Oscar.
Okay.
Kumekujwa. Watu ni wengi.
Good. We are starting.
We are starting.
Okay. So good evening, everyone. Good evening. Good. So we want to welcome each and every one of you to this event. Thank you so much for finding time to come. Just feel free, sit on your seat and relax as you watch the unveiling of the events. So once again, welcome. My name is Oscar Munyayo. I work in Ciheb-Kenya. I will be your master of ceremony tonight, together with my buddy here. Sema jina yako.
My name is Samuel Bobby and I am a hawker. I hawk things, I hawk condoms. Anything that you need, I can sell you anything, eh?
Okay, Bobby,
Karibu.
that's enough, that's enough. All right, yeah, so as you settle down, when you getting in, there are some exhibitions on your right. You can take a look of some of the work that we do with our program beneficiaries and the communities, just to get a better understanding. Yeah, but today we are happy to see all of you. It's a happy day where we are launching a strategic plan for Ciheb-Kenya for the year 2022 to 2027. So welcome. We are waiting for more guests to come and then we can officially start. Okay, so Bobby, what do you have for us?
I want you to turn to your neighbor. Give them a high five. Turn to your neighbor, give them a high five. Na umwambie karibu. Bado. Uyu. My friend here hasn't gotten a high five. Ulimpatia? Umepewa high five? Ama unataka lady ndiye akupe high five? Ladies, please. Ladies. Geukia mwanaume na umpe high five. Anaweza akawa amekaa kwa ukame, eh? Give somebody a high five. Na umwambie you look marvelous, you look wonderful. Amesema nini? Jirani amesema nini? Amenyamaza tu, eh? Good. So I want to recognize the presence of all men in the house, eh? Wanaume wote kwa nyumba. Wanaume, inua mkono. All men in the house. I want to recognize wale wamevaa smart, eh? Smartly dressed men in the house, eh? Wale wa polo shirts, tafadhali pole. Polo is not for dinner, eh? But, Mister, you look so smart. Uyu, Mr. Munyayo, anakaa namna gani Oscar? Wapi makofi ya Oscar? Hello? As we continue, ningependa pia recognize the ladies, eh? Ladies wale who are smartly dressed, wale wanakaa ni kama wameenda dinner, eh? I want you to help me look at your tables na uniambie ni mgani amevaa smart. Wote? No. This table, hii meza wako sawa? Sawa. I want you to rise on your feet. Waseme tu kama uko sawa. Ako sawa ama hayuko sawa? Sawa. Ladies, meza ingine pale, ninaona pale kuna hapo mahali Nyaboke yuko. Dr. Emily Koech amevaa African ye tutampatia apewe. Tunaenda hapa kwa hii meza hapa nyuma kidogo mahali kuna Dr. Patricia wako sawa ama hawako sawa? Wapewe. Aya, hapa je, this table wako sawa? Good. Hapo je, mahali kuna Dr. Rumunyu. Hapa mahali kuna mwanaume ambaye hanyowi ndevu, beard gang. Hakuna ladies hapo, we wacha. Huko mwisho nataka utuangalie exhibition tent Watu wako huko wako sawa ama hawako sawa? Wapewe. So I want us to appreciate the presence of all the ladies in the house na tuwapatie moja ya nguvu sana At the count of 3, 1, 2, 3. So I want you to help me to do something Si mumeona hao wanaume wako smart? Wako smart Yeah, nataka tuangalie kama wako na socks. Please, ladies, help me. Help me to search if the men who are smartly dressed are having their socks. Wale hawana socks niletewe hapa please. Kuna yoyote hana socks? Sawa kabisa. So I want us to do something. We remember the song that used to sing, if you are happy and you know, clap your hands. Ama hamuendagi church. You never went to church. If you are happy and you know, clap your hands. If you are happy and you know, clap your hands. If you are happy and you know, and you really, you don't know the song? Simuimbe na mimi. We can do it together, 3, go. If you are happy and you know, clap your hands. If you are happy and you know, clap your hands. If you're happy and you know, and you really want to show. If you're happy and you know, clap your hands. If you are happy and you know, stamp your feet. If you're happy and you know, stamp your feet. If you're happy and you know, and you really want to show. If you're happy and you know, stamp your feet. If you're happy and you know, say amen. Amen. Hallelujah. Jipigie makofi, you can do it. Oscar.
Yes.
Ni nini umetuandalia siku ya leo? What have you prepared for us?
We have a basket full of activities today. I'm very sure before you leave here, everyone will be full. Full to the brim. Okay?
Mark the word full. F-U-L-L, not F-O-O-L. Full.
So, ladies and gentlemen, welcome once again. We want to start our program. And just to let you know that we are also streaming live. And for the sake of our friends who are not able to attend today, you can check Ciheb-Kenya on YouTube live. And they'll be able to follow this event. Okay, so Bobby, I think we can start this event.
Yeah, we should. And soon our chief guests will be coming in. Okay. So tuta request akikaribia, we'll let you be alert so that tuweze kumpe hiyo heshima anastahili.
So, ladies and gentlemen, I request that we start off with the national anthem, and thereafter we are going to have an opening prayer by Joel Mosago. So I request that we all be standing so that we can sing our national anthem.
Thank
Thank you. You can sit down. Okay. We have seen the ones who did not take geography in primary school. Was it geography? Was it history? GHC. Okay. Okay, thank you so much. So, Joel, I request that you start us off with a word of prayer.
So I request you again, so that we be upstanding, all of us. So we're going to pray. And all of us, I think we are here because of this lady. Deuteronomy chapter 28, verse 12. And we are speaking those words to Ciheb-Kenya. The Lord nations, but will borrow to none. And we say amen. Let's pray. Mighty and everlasting God in heaven, CEO, the business official, and all the leadership. And Lord, we pray go forward. God, we pray that you rain your blessings to be upon us, oh God. In our utterances, in the feed, Lord God, even as we launch this strategic plan, Lord, we are praying praises because you are Jehovah and you are God. In Jesus' name we pray. Amen.
Thank you, thank you. Let's give a clap to our Lord. Thank you so much. So welcome once again. Welcome once again. For the guests who are still arriving, we welcome. Make sure you have the gift bag with you, which has some of our merchandise, a booklet which contains our program profiles, and many other things. So welcome. If you did not get any, make sure you see our ushers, and you'll be able to get one. So let me take this opportunity to welcome our Chief Executive Officer, just to welcome us officially to this event. I think she's going to show us where the washrooms are, whether there's going to be dinner. Bobby, karibisha CEO, atakuja namna gani?
DJ, can you unaweza mpatia kitu? Sound kidogo ya kuleta our CEO. Mpatie kitu hata kama ni ya mabega. Ngoja. Ka. Tunataka akulete. Ciheb team, hatuta escort daktari akienda kwa podium. You are here, eh? DJ, leta kitu yoyote. Anything African? Hello, si amevaa African wear, eh? Tunataka tumlete na an African wear. Na there is a big jeshi here to escort her. Aya, fanyaga rehearsal, eh? Mabega. There is a big team wanakuja kumpeleka.
DJ.
Inakuja African. Daktari. Pole. Daktari. Panda pole daktari. Wapi makofi ya daktari? Daktari unaenda namna hii. 1, 2, then you go round. Hapo tu. 1, 2, then you go round. Wapi makofi ya juu ya daktari? Kwani mnasikia wivu?
Thank you.
Daktari, karibu sana.
Indeed, it's a day of celebration, and so Bobby, you're allowed. It has taken us a lot to get where we are today, so allow us to dance and celebrate this milestone. The county executive members of health who are here today. I see my friend Dr. Ganda. We also have Migori, and we have Nairobi, CEC, and Machakos on the way. Chief officers and county directors of health, again from the counties. Representation, Head National Syndemic Disease Control Council, Dr. Ruth Masha. We have representation from CDC. I know Jennifer Galbraith, the program director, will be here. I've seen Dr. Katana somewhere. But CDC members who are here, Lucy, Karibuni. Members of the county health management teams, fellow implementing partners in this health space, and a special recognition of the Chief Executive Officer for Liverpool LVCT, Dr. Lilian Otiso, who's also our donor. Our civil society organization. Our partners from various sectors. We have our lawyers here. We have our auditors here. Our beneficiaries, the community representations, the communities we work with, Ciheb-Kenya, and UMB family, and other invited guests. Good evening. Good evening. Today I stand before you with an overwhelming and an overflowing heart. I'm filled with immense joy, humility, pride, and gratitude as we gather to mark a significant milestone, the launch of Ciheb-Kenya's inaugural strategic plan. This is our first strategic plan. We are so proud of ourselves. This moment signifies a profound achievement for Ciheb-Kenya, a journey that, like all journeys, or many journeys, has been unpredictable, but remarkably enriching. Ciheb-Kenya owes its existence, its strength, its resilience, and I use those words purposely because many people in the field have asked, who is Ciheb-Kenya and why them? We exist because of the unwavering support of the University of Maryland, Baltimore, represented here today by Dr. Man Charurat. An institution that has been the bedrock of our foundation, enabling our establishment and providing a platform and structure that has guided our growth. As we unveil our strategic plan, a compass to steer us towards our well-thought-out vision and mission, the magnitude of this occasion is humbling. It prompts reflection on the impactful work we've already undertaken across 13 counties represented here today, collaborating with national and county government and with partners to deliver essential services, and in the last 3 years around HIV, TB, immunization, and the recent honor bestowed upon us by our donors, CDC, to support Kenya's second population-based HIV impact assessment survey. No mean feat. Tonight, 2 days shy of the World AIDS Day, and a day after PEPFAR's 20th anniversary celebrations, we take pride in the global commitment demonstrated over the past 2 decades towards this one disease, HIV/AIDS. This commitment has significantly impacted the lives of families worldwide and emphasizes the power of collective action in addressing global health challenges. Ciheb-Kenya, though very young, will go down in history as having been a part of this history, or this story. However, similar efforts have to be harnessed to fight other challenges of public health concern. We at Ciheb-Kenya are here, standing to be counted as part of these global and national efforts, and we are committed to supporting this vision, including Kenya's efforts towards universal health coverage. Ciheb-Kenya's vision to contribute to this noble agenda is not merely a vision. It's a reality that keeps us focused on the reason for our existence. A warm welcome to each of you gathered here today for this momentous occasion. Your presence here today bears witness to our shared commitment to enhancing the health of fellow Kenyans. You're integral to our journey and we eagerly anticipate holding ourselves accountable to the strategic directives we set forth today. I end with this quote from Henry Stanley Haskins: "What lies behind us and what lies before us are tiny matters compared to what lies within us. Within us is a fire burning strong, a desire and an unwavering resolve to make a difference in this world every day." Karibuni.
Thank you, Dr. Koech, for that warm word of welcome. Thank you so much. We can appreciate her more. Thank you. So what Dr. Koech has not said, I think it can also be said better in another form. And I want us to take a few minutes, 10 minutes, just to complete our welcome address, but just seeing and having a snapshot of what Ciheb-Kenya has come, where it has come from, and what it's been able to do, and probably where we envision to be in the next 5 years of this strategic plan. So I want us to take a few moments just to look at, watch a documentary, just highlighting the work that Ciheb-Kenya has been doing since its inception. So our team, okay. So we have
and has the right to the highest
around you. So if you can't see this clearly, you can turn on your side. I'm sure there's a screen which is working.
Kenya's constitution provides that every person has the right to the highest attainable standard of health, which includes the right to healthcare services. To this end, the Center for International Health, Education and Biosecurity, Ciheb-Kenya, a Kenyan non-governmental organization, is collaborating with national and county governments and with communities, transforming lives by ensuring access to quality healthcare and fostering innovative solutions to health service delivery.
The Center for International Health, Education and Biosecurity, popularly known as Ciheb-Kenya, is a local, non-governmental organization registered in 2020 and formed out of the University of Maryland, Baltimore programs in Kenya.
Ciheb-Kenya's story began in 2004 at the start of the US President's Emergency Plan for AIDS Relief, PEPFAR's funding, when University of Maryland, Baltimore, UMB, established its first HIV and TB service delivery programs in Kenya. Over the years, they evolved, identifying innovative solutions to bridge the healthcare divide. Transition to a local organization was one of UMB's strategic goals.
Our strategic plan has phases that started with having U.S. faculty and staff on ground in Kenya leading the program, then having Kenyans leading the UMB program, and finally having Kenyans lead their own programs. Trust and truly human-centered services happen when Kenyan citizens sees their fellow Kenyans leading and managing.
The university's key objectives in its partnership and collaboration with Ciheb-Kenya is to enhance its capacity to be able to address the healthcare challenges within the Kenyan context, and to do this through really building their technical capacity and their research and academic strengths to be able to provide solutions. And this can only come through diversification of funding and accessing funding that can help to implement these programs.
Ciheb-Kenya is implementing public health programs in 12 counties predominantly, strengthening health systems for the provision of quality HIV and TB services, supporting immunization including initial COVID-19 vaccination scale-up, and now integration in health facilities plus routine and catch-up immunization for children and other eligible populations. These programs are PEPFAR CDC funded, including Truck, Connect, Entrench, Pact Imara, and there's a subrecipient of LVCT in the USAID Stawisha Pwani program.
So Ciheb, having offered more than 95% of the clients HIV test and linked more than 97% of this onto treatment and supporting the same clients to attain viral load suppression. Currently, our viral load suppression is more than 97%. So that ensures that the clients that are actually infected continue to live to their optimal potential and they're not spreading the virus. So overall, we are contributing to the epidemic control for the counties that we support as well as the country at large.
When I came, it was my clinic day and we went to the clinician and the clinician disclosed about my status. And I've been on ART since 2012. I've been taking my ART here at Riruta Health Center. Kwa sahi nafurahia juu load yangu iko chini na hiyo inamaanisha virusi vyangu vya chini ziko poa na immune system yangu iko poa juu naweza fight hizo virusi hizo zenye ziko ndani ya mwili juu nimekaa for LDL for 5 years kumaanisha virusi zangu ziko chini.
Ciheb-Kenya's vision and mission articulate a focus on achieving excellent health indicators and outcomes in the communities. Through its programs, Ciheb is working with general target markets, that is adults, adolescent and children, and key populations including men who have sex with men, female sex workers, people who inject drugs, and transgender individuals, addressing the unique needs for each population group. Sustainability is core to Ciheb-Kenya's strategic direction. Therefore, the Board of Directors and Management have put in place sound business systems that assure efficient, effective, and economic use of resources with oversight from the Board of Directors.
Ciheb was registered in 2020 and got initial funding from University of Maryland. By 2020, their funding was to the tune of $5 million. Between the period 2020 and 2021, Ciheb portfolio grew from $5 million to $50 million. That is 1,000% growth. The management was very intentional in making sure that it aligned its business systems, its staffing, to be able to manage the risk that comes with managing such a huge portfolio. The management was also very intentional in making sure that the business systems were rapidly developed to be able to accommodate the increase in portfolio growth.
The role of the Ciheb-Kenya Board of Directors is to ensure that sound policy framework has been put in place to manage the funds that the organization receives, and that management thereafter reports on a regular basis to the board to ensure that the policies are being implemented and that the finances are being managed in an efficient and effective manner.
Partnerships have been the cornerstone of Ciheb-Kenya's success. The organization is working closely with the Ministry of Health, county governments, donors, other like organizations, and communities affected to achieve these monumental milestones. These collaborations have amplified their impact, delivering healthcare solutions that are greater than the sum of their parts.
We have strength in service delivery, in building human resource for health, and this is not just capacity building or training and mentorship, which is really our core business, but also we've worked closely with county governments to engage a multidisciplinary team of healthcare providers who are direct service providers, providing the healthcare services in health facilities to Kenyans who require this.
Ciheb-Kenya's programs have touched hundreds of thousands of lives. Their achievements have transformed healthcare for communities.
Thank you so much for that session. You know, when we were growing up, some of us, our dream was to appear on the TV. So for the ones who appear there, I think they have self-actualized. And yeah, so Bobby, we want to shake a little bit. Shake. Before we get to the next session.
Hello? Are you ready to shake? Rise on your feet, please. Itakuwa kidogo tu, eh? Kidogo tu. DJ. Hiyo watu wanapigaga makofi ya juu tu.
Ha ha ha. Tumeona mkono wake Bwana.
Daktari ati nini? Tunakanyaga polepole.
Mengi mazuri tumeyaona.
Hey.
Mungu umetenda.
Daktari ameenda.
Wewe muweza.
Kuja. Tunafuata mutaratara. Ati chini. Chini hata juu. Watu na wainua. Anza hivi, unainua mikono juu, unaweka kwa mabega. Unaweka kwa kiuno. Hapo unachapa. Juu. Kichwa. Mabega. Kiuno. Chapa. Juu. Ai. Kichwa. Mabega. Kiuno. Chapa. Juu. Kichwa. Mabega. Kiuno. Chapa. Haya, tafuta jirani. Look for a neighbor. Tafuta jirani namna hii. Uko na huyu. Wacha nikuonyeshe example. Haya. Unafanya hivi. Haya, tena unageuka. Ngoja tunaonyeshana example. Tena. Tafuta jirani mwingine. Look for another neighbor. Do you have a neighbor? Anakuogopa. Hey! Tafuta mtu. Mikono juu. Weka kwa kichwa. Weka kwa mabega. Weka kwa kiuno. Chapa. Haya, weka wiper kidogo. Wiper. Woo! Wapi nduru hapa? Haya, tukakae. Are you happy? Are you feeling good? Hey.
Thank you. Let's clap for ourselves. Okay, thank you for that session, Bobby. All right, so as I say, there's the lucky people who are on the screen, who are on TV, and I want to, just for fairness, invite one of our program directors who was not on TV so that we can see her live. Yeah, but I want to welcome Dr. Rebecca Wangusi, just to briefly give us the status of Ciheb-Kenya programs from where we started to date. So Bobby, please assist me to bring Dr. Wangusi on stage.
Huyu ni Mluya. Mluya, rudi huko chini.
Just shortly Bobby.
Hata simleti, mweke tu mlongo ama vaida. Ile itamuleta. DJ, ngoja, usiende mbio. Tumetoa tension, All we were doing was to remove the tension and everything. DJ, mweke kitu ya Kiluya na anapanda peke yake huko. We unaenda haraka. Anzia hapa. Wapi Waluya? Don't stop.
and gentlemen. Okay, ladies and gentlemen, let's welcome our program director for Connect, Dr. Rebecca Wangusi.
Yeah.
Thank you.
Thank you, Oscar. Thank you for giving me an opportunity to appear on YouTube live. Now that the communications team did not put me on camera, but I just want to recognize our distinguished guests here today, the county executive members for health for Nairobi, Makueni, and Kisumu, our chief officers and county directors of health who we work very closely in the counties that we support, the head NASCOP representative, Dr. Rose Wafula, the representative of the head National Syndemic Disease Control Council, Dr. Ruth Masha, the program director for CDC's Kenya's Division of Global HIV and TB, Jennifer Galbraith, the CEO for LVCT, who is also our donor, Dr. Lilian Otiso, members of the county health management teams, all our fellow implementing partners in this health space, the civil society organizations, partners from various sectors, our beneficiaries, my Ciheb-Kenya colleagues, the UMB family, and all distinguished guests. Good evening. That was the most difficult part. Yeah, so on behalf of the Ciheb-Kenya programs, we're actually very honored to have all of you today here. And I was happy that they put an interlude in between so that you could forget what was on the documentary. I was almost telling the communications guy, please pause because you're presenting my whole presentation. But I'm going to just go briefly to discuss what we implement, where we implement, and how we do it. Yeah. So I think this is not a new map. You have seen it in the previous documentary, just showing where we are. So we have 5 programs which are currently being implemented this year. One of our earliest program, our earliest, you know, when you're a young baby, when you first get your first, let me say milk, was TRAC. The TRAC program is majorly an immunization program, and we are very proud of our TRAC program. They started off as a small program implementing COVID-19 vaccination, but you'll see how it stands in Nairobi. It stands for County Ownerships Network for Nairobi Epidemic Control. This grant was written with the intention that after the 5 years of implementation, we'll have a county-owned and county-led HIV response in Nairobi. The third program is called Entrench. Entrench is a similar program to Connect, implementing HIV service delivery in Migori and Kisumu. We also have our Pact Imara program, which implements HIV service delivery in Kitui, Makueni, and Machakos. There's someone who needs to catch up with me. Yeah. And then one of the first fundings we also received, we really want to thank LVCT for just trusting us. We wrote the USAID's Tawisha Pwani grant and we are happy that they found us, when we were very young, they actually allowed us to partner with them in the cost implementing the HIV care and treatment package in the 4 counties. I'll move on just to my next slide to talk a little bit about TRAC. And for TRAC, I've mentioned that it started during the COVID pandemic as a vaccine program implementing with the Division of Vaccines and Immunization. And within that first few years, they were able to vaccinate over 1.5 million Kenyans with COVID-19. And after that, they have been able to implement several other projects. Sorry, I'm not very able to see. I don't know how to, maybe I can move. I'm the one having an issue with seeing the slides, yeah. Apologies for that.
Thank you. Allow me to step down. I think I'm aging, so my eyes. Okay. Allow me to stand here. This is better. So I was talking about the track program, and some of the other activities that they have implemented was the COVID-19 post-introduction evaluation, which we called CPI, in collaboration with the Ministry of Health. They've also, in relation with the COVID-19 activities, implemented a knowledge, attitude, and practice survey for COVID-19, and also routine immunization to inform the current vaccination policy. And as an extension, they've also been able to implement catch-up vaccination in Siaya County, which tries to look at all those children who missed immunization when they were supposed to get it, and try to reach them wherever they are, in their homes, in their communities, and be able to administer immunization to them. And currently, the track program is actually implementing a polio serosurvey, which aim is to evaluate the effectiveness of the OPV2 vaccine response in 2 counties, Tana River and Kitui. So let's give one hearty clap for the track team. 1, 2, 3. Thank you. Our next is just to show how our 4 service delivery grants that implement the HIV program, what they have achieved over the last 2 years. And we are proud that in the last 2 years, we've had more than 1 million people who did not know their HIV status actually access a HIV test and get to know their HIV status, with more than 33,737 individuals testing positive in those counties. We are also able to initiate around 42,480 patients on treatment, and that when you look at the linkage for those who were tested vis-a-vis those who were initiated on treatment, our linkage was around 93%. So for the mathematicians who are stuck there, just to say that for testing, we reported data for the grants that we are Primes, Connect, Entrench, and Pactimara. So don't get worried about the maths. If the maths is not mathing, just trust me. Sawa? Yeah. So for the Ciheb-Kenya programs have around 331,004 clients who are active on treatment, representing a very huge proportion of Kenya's patients who are on treatment. Among those, we have around 97% who have actually achieved viral load suppression. For those who do not understand what viral load suppression means, this is when your blood sample, actually there's no HIV virus being detected in the lab. I hope I have explained it. Yeah? You have all understood what I have said. That when you take your blood sample, because you have been on ARVs, we measure the amount of virus in the blood, it's actually undetectable. So we are very proud that this suppression is actually higher than what we actually observe for the national program. We were able to test more than 400,000 women, pregnant women, for HIV. And among those, we have around 22,473. 99% of all the women who we tested and they were HIV positive being started on antiretroviral treatment. This means these are actually averted infections. We are preventing them from infecting their newborns when they are pregnant. So we are happy about that achievement. We also were able to serve 23,875 HIV-exposed infants who had a test done. For TB and HIV testing, we were able to test 31,937 new and relapsed TB cases for HIV, and among those, around 8,103 were able to receive ART. We have a very huge prevention program, and part of what we implement is services for people who inject drugs and who receive methadone. For those who do not know methadone, it is a drug we give you so that you stop injecting heroin, and the aim is that you have a better quality of life. So we have our patients started on methadone, and after that, they get jobs, they get reintegrated back to their families. And for more about the methadone program, we have a stand right at the entrance where you can get more information. For the other key population typologies, we serve all the typologies, the female sex workers, the men who have sex with men, the transgender, and among us, we have been able to reach 188,979 key population in the last 2 years. And we have a very vibrant DREAMS program, and DREAMS stands for determined, resilient, empowered, AIDS-free, mentored, and safe. This is a HIV prevention program that actually looks for the vulnerable girls in the community, and we offer them a comprehensive package to help them prevent HIV infection. And with that, we've been able to reach 130,306 girls in 63 wards. I'll move on to my next slide. And my next slide just talks about how the clinical cascade, just in pictures. But what you can see is this slide is among the different age groups, our viral load suppression, which is the last box, is actually very high, at around 94% for our children, 93% for those who are 15 to 19-year-olds, 95% for those between 20 to 24-year-olds, and 25 plus at 98%. This is actually a mark to the quality of services being provided by our healthcare workers and by our technical teams on ground. For our DREAMS, this is just a sample of the girls we've enrolled on the various years. We've been able to support more than 30,000 girls with education subsidy in terms of school fees and other support, economic strengthening activities, including business startup kits. We've been able to offer to more than 20,000. We've been able to reach more than 30,000 caregivers and be able to give them trainings on how to deal with their adolescents, but also how to do what we call positive parenting. And then we've been also able to reach more than 6,484 schools in the 3 counties we implement DREAMS. So how we do it? Our goal for Ciheb-Kenya is to strengthen the public health response by implementing people-centered health service delivery models, providing efficient and cost-effective solutions for health. And we do it in 3 ways. One of them is by meaningful collaboration with communities, institutions, national and county governments, and I'm happy that they are all represented in this room today. The second way is the health system strengthening approach. Even though we are largely funded to do HIV, but we go beyond that single disease and go beyond the program life. So all our programs, we are implementing them with the end in goal, which is sustainability. Then the third approach is building technical competencies in health by continuously and routinely studying to improve ourselves. And all our programs are actually hinged on the continuous quality improvement framework. So I'll start by just looking in depth on our health system strengthening approaches. And on to my next slide. A key is building sustainable health systems. And so far we've been able to conduct baseline assessments in 6 counties that looks at where are we when it comes to sustainability. If the donors are to move out, where would our services be? So we are proud that we've been able to work with the county governments to achieve this. We have been able to set up county transition teams in all these counties, and we've been able to develop and launch transition roadmaps in 5 out of these 6 counties, and train county leadership, not only in the counties we support, but also in the other CDC-supported counties, on including the county public service boards and the Public Service Commission. Our second pillar for health system strengthening, on the next slide, is building leadership and governance. And we are proud that during the last 2 years, we've been able to put in effect memorandum of understanding between Ciheb-Kenya and the counties. We've been able to establish county HIV stakeholder forums in 4 counties, assist in reviewing the county AIDS implementation plans, and coordinate county annual performance reviews, in addition to carrying out organizational capacity assessment and strengthening. So this is just photos just showing what we have done with the counties. And in the next slide, just to show what we do in terms of human resource for health. We not only employ and train, but we've been able to go beyond that to revamp the human resource for health technical working groups that addresses key issues like performance appraisals, IRIS, staff returns, and we've also been able to support HRH mapping in collaboration with the counties and CDC. So this is just a summary of the health workforce that we support. In total, we support 2,298 care workers. This is a multidisciplinary team of healthcare workers from counselors, clinicians, nurses, lab techs, farm techs, and the list is very long. And we've been able to support more than 2,000 volunteers. And when you look at the HRH investment in Kenyan shillings, I'm very good in dollars. Yeah, thank you, Dr. Koech. Yeah, I deal with dollars. So I'm being told it's 1.9 B. Every year, this is just for this year, every year goes towards HRH support. So I really wanted to mention that part of our HRH support involves communities. And Ibrahim, you can see yourself there. Yeah, we are really proud with the work that our volunteers, our peer educators, our case managers, our mentors, our champions are doing in the community, and really want to appreciate. And because they are in this room, we have our autism champions. I'd kindly request you just give them one hearty clap for the work they do on the ground. We truly appreciate the man, the team, they are there. We have the KPPs. In terms of health financing, the photo is to draw attention. We have been able to support the counties to come up with the county investment development plans and strategic plan, and support some counties to do advocacy at county assemblies for ring-fencing of the HIV budgets. We are very happy that 5 out of the 6 counties we support actually have received G2G funding. And we have also been able to conduct sensitization on the FIF bills in Nairobi County. And what we are working on is advocacy to people living with HIV to take up NHIF to offset out-of-pocket costs for the other conditions like NCDs and so on. So this is a summary of what we've been able to directly fund to the counties. This is in US dollars, so I'll read it out for you. So for Ciheb-Kenya in FY 21-22, we were able to subgrant 5 counties, a total of 2 million. Sorry, the addition is, ignore the addition. For FY 21-22, actually it's right, 2,373,707 USD. The following year, we were able to, that shows our year 2 for these programs, we were able to finance 2,353,455. This is direct as sub-grantees. So this year, we are funding, in addition to the 5 counties, we have Kisumu County joining the rest of counties to receive a sub-grant under Ciheb-Kenya, and the total amount being sub-granted is 5,340,315 USD. This is USD. So you can take your calculator and do times 150. So we are actually very proud of the collaborations we have with the counties. And just to mention that one of the things we do is infrastructure support, and this is just an example of the facility renovations. I usually like talking about Babadogo for a specific reason, because I love TB, but also I left Ukambani to come and work in Nairobi. I think it's almost 10 years now. And I came to Babadogo and I found, that was under TB Act then, the TB clinic was being held in that, we call it Kibanda, and I was so shocked. That is where the patients used to being seen, those who have TB. But I think with the support of Ciheb-Kenya, you can see what happened to the Babadogo TB clinic, moving from a Kibanda to a very good room where you are also comfortable. So this is just a picture, but I know across all the counties, you'll get that Ciheb-Kenya has repaired, has renovated this and this clinic, which you are happy. For laboratory system strengthening, we have 12 laboratories that are ISO certified. And in the last year, we were able to network more than 200,000 samples, which is at a USD rate of $121,581. And we've been able to improve several labs across the 6 counties and install 12 equipments, various equipments in our laboratories during that year. And this slide just shows part of what we do as health system strengthening, supporting commodity and supply chain management. And we have a total of 329 facilities with integrated ART dispensing and 387 facilities reporting in KHIS. And what you can see are the photos of before and after implementing 5S. One of the key things we do is to ensure good commodity storage, even if, in addition to ensuring good reporting and good forecasting. So you had moved. So I'll talk a little bit about our building technical competencies, which we do through 2 main approaches. And one of the approaches that we use is actually the CQI approach. And we were happy that our CQI dashboard that was formed in collaboration with UMB has actually been adopted by many partners across the country and not really being used at Ciheb-Kenya platform only. So we are happy for that, and you can give Ciheb-Kenya and UMB a clap, right? So I wait for the slides to move. Yeah. So this is just what we are calling a learning health system, because we are always trying to innovate. And I just picked some of the key things I can say that stood up for our programs these 2 years. And one of them is innovative health service delivery models. And we are proud that we were able to launch a mobile mat dispensing that came in handy during the COVID pandemic. So that was a big plus for us. But one other thing that we did implement was the virtual platforms. We were able to adopt virtual dots for our patients, but also virtual platforms to reach hidden populations, hidden key population, and hidden those people who will not come to the facility, just to be able to ensure that they access services. One other thing that we think is game-changing is we've been able to implement strategies over the years that have been adopted across the country. And one of the strategies that we've implemented is social network strategy for the general population. And we are very proud of our HTS team led by Jarvis and team for being able to come up with this innovation, which is now being implemented across the country. Next slide. Yeah. So this is our journey in learning, research, and evaluation. And just to go through it, as a new organization, sometimes you struggle with writing, but we are very happy that over the years, you can see we've had several abstracts, several protocols being developed, and we've also had 4 peer-reviewed articles being published in the last 2 years. See, we deserve a clap. Yeah, thanks. So we hope that we'll continue learning and through evidence-based interventions and writing. So I really want to speak on meaningful collaborations. I think for us as Ciheb-Kenya, we will not have been here if it were not for the partners who are seated in this room and others who are not seated here. We recognize UMB as being one of our key partners, just giving us the space and the opportunity to form this organization and to implement. But then my next slide, just to show some of the partners we have. We actually have more than 19 partners that we sub-grant to. But we work with very many partners. And if your logo is not there, just know you are appreciated. So really just to thank all of you and acknowledge PEPFAR and CDC for the funding. We also want to acknowledge our county governments, the national program, our healthcare workers, our beneficiaries, the other implementing partners we work with, and the communities who are here. Thank you so much.
Okay, thank you so much, Dr. Wangusi. We can give another round of clap. Thank you so much. I think listening to Dr. Wangusi carefully, there was a lot of mention of the counties, 6 counties we've been working together to change the life of Kenyans. And I'm so happy that we have all these 6 counties here represented, and this is our celebration of our achievement together. So I just want to request the CCs who are here representing the counties to please stand up so that we can appreciate you. The CCs who are here, please stand up, and then let's appreciate CCs. Thank you so much. Thank you. This is really you are doing. This is really you are doing, and what you are doing, we are also preparing so that you can take on this. And I'm sure you are up to the task, as Dr. Wanguse presented here, with the assessments that we did, readiness assessments, and the counties did very well. And what is remaining is just a few polishing up here and there. So thank you so much. We are proud of you. Those who came a little bit late, there's a choir which was here. They don't like the name choir. They call themselves band. But this is a very popular group. You must have seen it in Bomas. So before they go back to Bomas, and you know they can sing. They can sing for a long time. So I just want to give them just one. All right, thank you.
Let's appreciate our MC. And by the way he's dressed, he's a professional best man. So just in case you have a wedding and you not have a best man, he's a best man for hire, and he's doing a wonderful job. Now, you have been doing the clubs like this. It's been a cliche. Now I want to teach you what you'll be doing, especially today when you're doing the launch. Now, when I say Ciheb, you clap once. Let's try Ciheb. Now I say Ciheb-Kenya, you do it 4 times. 1, 2, 3, 4. All right? Ciheb-Kenya. And then the strategy, because you have for the whole year, and they also our sponsors and every other person who here, the CEO and everyone. So when I say the strategy, you do it 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Simple, right? Ciheb. Ciheb. Surely. Ciheb. 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 Ciheb-Kenya. Ciheb-Kenya. Strategy. Now you have to do it in a melodic way because you're musicians here. So you do it in rhythm, yeah? So I say Ciheb, Ciheb, Ciheb-Kenya, Ciheb-Kenya, strategy. Thank you very much. Msisahau hiyo. Now we want to do this song. It's a very popular song. It was done many years ago. Hiyo wakati tulikuwa 1964, Yeah, okay, before even the Kenya was born. So you have to do this. It's just to encourage the proud Kenyans who are here, and even the visitors and sponsors. So if you are proud to be in Kenya, and you are proud to be a Kenyan, I request that you be upstanding for this song. And I know you know it, but we shall be guiding you. You can clap, you can jump. You can move a bit, you wave.
Tushangilie Kenya, taifa letu tukufu, Kenya tunayoipenda. Tushangilie Kenya, taifa letu tukufu. Kenya, nchi yenye baraka daima, twajivunia sana tukijiita wa Kenya, nchi yenye baraka daima. Kenya, nchi yenye baraka daima. Kenya, makao yetu ni nchi ya usalama, kamwe hatutaiacha daima. Kenya, makao yetu ni nchi ya usalama, kamwe hatutaiacha daima, kamwe hatutaiacha daima. Anayependa Kenya ni yule mwenye kupenda haki kwa watu wote daima. Anayependa Kenya ni yule mwenye kupenda haki kwa watu wote daima.
The moment of fame. Please take advantage. He will appear tomorrow in the Daily Nation.
Ujitenge na mambo yenye kuvunja amani. Ukipenda Kenya ujitenge na mambo yenye kuvunja amani. Hatutaki matata.
Everybody, Okatra, we don't want.
Hatutaki matata.
Don't want violence. Make some lovely noise, Ciheb-Kenya. Some noise, some noise.
Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, nchi yenye upendo, hatutaiacha daima na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Mama yangu tena ni baba yangu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Hapa wote wananchi wa Kenya, kutumikia Kenya daima na milele. Kenya kipenzi chetu, hatutaiacha milele na milele. Kenya kipenzi chetu, hatutaiacha milele na milele.
Look at your neighbor. Look at your neighbor. And
mimi ni mwana Kenya.
Daima tell your neighbor that you are a Kenyan and you are proud to be a Kenyan. And you shall be back. Utakuwa nenda likizo tu.
Sitadanganywa kamwe na wabaya.
Salute to Kenya. Salute to yourself. Salute your neighbor.
Mimi ni mwana Kenya daima.
Show them some love.
Kenya nchi yangu. Mimi ni mwana Kenya daima.
Thank you very much. You may sit. Bwana MC, msema chochote?
Thank you so much. We can appreciate them again. Okay. I told you where they come from. Please don't go back. I still have some work for you. But thank you for that session. So, ladies and gentlemen, we want to switch gears and just get some testimonials from a representation of the people we work with, our program beneficiaries, the people who we impact with our programs. So, Bobby, I'm going to ask you to help me to bring here Rita Gatonye, who represents one of the programs that we work with, rehabilitating people who inject drugs. And this is one of our champions that we really celebrate. So, Bobby, please help me to welcome Rita to the stage. Okay.
Good evening, everyone. Good to be here with you all. My name is Rita Gatonye, as has been too close to this microphone. My name is Rita Gatonye, and I have been told you are the evidence, so come here and be the evidence and present why this program is so important. Maji, itoe, ndio upige picha vizuri. Plastic, by the way. Ciheb. Should be moving on with the times. Okay, so my name is Rita Gatonye, and I'm a beneficiary of the methadone program in Kenya, which At the time it began with the University of Maryland. This is back in 2014. So it may not look like it now, but I was an injecting drug user. I was injecting heroin in Nairobi and Mombasa. And that, of course, is never a pleasant experience. Dropped out of school at the time and continued using drugs, and that led to a life of addiction, which I don't know if you've seen these videos of people in Mombasa looking like, you know, zombies and all that. That is the reality of injecting drug use. So I'm happy to be able to stand here and say that harm reduction works, that these programs that money is being poured into, they actually do work. I don't know if everyone is aware of what that harm reduction program entails, but as has been mentioned here, there's the methadone, there's the psychosocial support, there's the counseling, there's overdose management, there's training people on how to use drugs safely, because let's face it, we cannot get rid of drug use completely, not in this lifetime. So the object of harm reduction is to make sure that we have a safer society, that we have a more informed group of people, and then eventually people come to their own decisions to either stop using or to use safely or whatever is their reality. So in that, I'm not really sure, Tina, but I have my doctor here, who has always been my doctor, even before I knew I was predisposed to addiction. And I think this is why we're talking about the need for Ciheb to scale up these services and to really invest more in harm reduction services, because they're affecting more and more people every day. I'm not really sure how to draw that picture, other than to say that it works, and that once people come out of that situation of addiction, then they're able to become productive members of society. So once I was able to finish that methadone program in 2017, then I was able to go back to school. I was able to open my own organization, which now reaches out to women and young people who use drugs. Yes. So clap for the University of Maryland as well, because that is all thanks to them. Of course, there's a mat stand there for anyone who would like to know more about what that program looks like. Right now, what we are working on, and we would like to really collaborate with Ciheb in this effort, is the drug policy change effort. So we realize, and we're glad that Ciheb has come into the space. We realize that drug use is a public health issue and not necessarily a criminal issue. And again, this is what underpins the harm reduction program. So you don't tell people to just stop, and you don't arrest people and take them to jail. What you do is provide avenues for treatment. And this is what we have with the 3 clinics now that Ciheb is running. Provide avenues for treatment, provide avenues for differentiated treatment. For example, the mobile clinic, there are people who cannot travel to access services. There are women and young people who cannot travel to access these services. So bringing the services closer to them is also something that, and having the policies that enable that to happen is also something that is being done and is very important. And eventually, hopefully, changing the law to allow for treatment instead of incarceration. I think everyone in this room knows at least 1 or 2 people who have issues of addiction. And I can assure you that number is rising. Every day it is rising. In this economy, it will rise even higher. So, so the work that Ciheb is doing is very, very important. And I want to challenge Ciheb as well, because you've talked about system strengthening, health system strengthening. If we want to strengthen the system that deals with drug use, then we must invest in organizing for people who use drugs. The same way we have MSM and transgender organizations and sex work organizations running programs, even when the donor has left, programs are able to be sustainable. This needs to be done for people who use drugs as well. We need to also be a bit more understanding of the treatment cascade for people who use drugs, because addiction is a continuum, it is lifelong. We may not see And I'm saying this to you because I know you've come into the harm reduction space and you're doing very well. And I know you'll face these challenges. And I know you'll be asked questions as to why is the program not scaling up, or why are we not reaching targets the way other programs are reaching targets, the way the vaccine program is reaching targets. And I'm just challenging you to bring in the community even more so that it can be understood that treatment for drug use is lifelong. It's a continuum. You will have low retention, you will have relapse, you will have social, economic issues that will need to be innovated upon in order to have better outcomes. But that I think we are really on the right track with this. And I want to thank you for coming into the harm reduction space. I want to tell you, you have the support of the whole community. You have all of us behind you. And yes, the system works, harm reduction works. So congratulations to you. And yes, let's keep working together.
Thank you so much, thank you. So the message is very clear. The message is clear that drug use is a public health issue. And this is the message that, and this is the gospel that we've been preaching in our programs. And thank you so much, Rita, for being a testament to that. So next, we have the Dreams program that Dr. Angusi described. And you know, when Dr. Angusi was running through the slides, I could see Katana pulling out Dr. Katana pulling out a pen and paper. I think he was almost, coming to put comments here. So I'm confused that this is a CDC quarterly. Dr. Katana, we are launching our strategic plan. Please don't ask why our viral uptake is 89%. So, ladies and gentlemen, help me to welcome our dream girl, Cantwell Jerry Otieno. Please move forward, thank you. Okay. So this is one of our most exciting programs again, where we impact the lives of adolescent and young girls. And Cantwell here is here to just represent those girls. Karibu sana. Let's give her a clap again.
My name is Cantwell. I first heard about Dreams in 2019, and this was immediately after I had completed high school, and I was just at home doing a lot of nothing. And I was living in Mathare, Mashimoni, with my aunt. The reason I was living with my aunt is my parents passed away when I was very young, so my relatives have brought me up. And the situation at home back then, it was very, very dire. Anything apart from shelter and inconsistent meals was a luxury. And so one day I met a friend of mine, and she told me about Dreams. And the fact that she mentioned empowerment, even though then I didn't really understand what empowerment meant, the thought that something could come and save me and just change the situation excited me. And so I told her, yeah, why not? She came to our house and she enrolled me. And the following day, I was taken to the Dream site at Mathare Hospital, Mabatini. And I was attached to a mentor. And this mentor was like a big sister. She would listen, she wouldn't judge, and we would have those conversations that really couldn't have with anyone at home. And I had started attending social asset building sessions, and I met other girls who were like me, and they were going through what I was going through. Some were going probably through more than I was going through. And the fact that we were there together gave me the courage that all could be well, and maybe eventually things might change. I also went through financial capability training, and here I learned about to save and spend money wisely. I also received biomedical services where I got to know my HIV status, and I also got to know things that could put me at risk of contracting HIV and how I could protect myself. I was educated on PrEP, the different family planning methods, condom education, and demonstration. I also underwent entrepreneurship training, and I learned what it entails to start and run a business. And I was supported with a business startup kit of 8,000 shillings, and I started selling bags and shoes to women in our community. Eventually, I partnered with my aunt and started, and we make a profit of averagely 6,000 shillings a month, and this has helped. I also attended vocational training where I took a computer course, a chance that I did not get in high school or even after completing high school, since I didn't have anyone to take me. And today I am using those skills that I learned at that vocational institution. I am pursuing a data science course, and that is really a good thing. I was also identified and trained as a mentor, and I was given a cohort of 60 adolescent girls and young women aged 10 to 14 years. And while mentoring these girls, I could see my young self in them, so scared about the body changes. Menstruation is here, peer pressure on the other side, and one doesn't know who to turn to, who to speak to. And I am privileged that I got the chance to hold their hands and tell them, you know what, it's okay. That's part of growing up. I was also trained as a financial capability trainer and as a IPTG mentor. IPTG stands for Interpersonal Psychotherapy for Groups. So this is whereby we sensitize girls about depression, we screen them for depression, and later those who have turned positive, we start group therapy sessions with them. Later, I was employed. I am currently supporting the Dreams Connect project as a project assistant in Kayole site. So Dreams has really impacted how I view things and how I make healthy and informed decisions. And even though I was graduated from the program after being fully layered, empowered, AIDS-free, mentored, and safe. Finally, I would like to take this opportunity Kenya Ministry of Health, Ciheb-Kenya Connect, and Hope Worldwide Kenya for giving girls a chance to achieve their dreams. Thank you.
Thank you so much. Let's appreciate her again. Thank you so much, Cantwell, Jerry, for that boldness and for being a model and a mentor to your fellow girls. Thank you so much. Next, we have our own Ibra. Let's clap for Ibrahim. Ibra, uko wapi? Oh, great. Okay. This is also a young man who I like, and he has a very captivating story. So let's be all ears to listen to him. Karibu.
My name's Ibrahim Lwingi. I prefer being called Sahim. And I'm happy to be here with you this evening. And I can say I'm here to represent the LGBT community. And I can say every LGBT people have a right, and they are just people like everyone else, and they should not be dismissed. They should be embraced, and maybe by moving closer to them, you will learn one or two things about them, and and everyone has a story to say. So my story, I'll give you a little bit of experience or my journey up to where I am right now. Back in 2015, I didn't know where to go by then, and I met someone online And from the community I come from, meaning that the LGBT community, you can meet someone today and you end up having a lot of things with that person the same day. So after 2 or 3 days, I started feeling funny. I had an infection, so I had to seek medical attention. And as a man, if you know a man, in order for a man, or when a man now reaches a point where he has to seek a medical attention, know that that man is in a lot of pain. So I went to the nearest health center, and when reaching the health center, I was sent to give my specimen. So I went to the laboratory. I was asked to give urine, so it was tested, and it was found that I had some infection. So when I went back to the clinician room, English messed me up. I wish I used Swahili. So he asked me, we would like you to come with the person you are with so you can be treated together. So I told him, this person, I met him online, is someone that I don't know. So there is where English messed me up. So he said, him. So he kind of relaxed, and he walked out, and he came back. Then another, I think a clinician or a nurse came to take a file in the room, but he looked at me, so I just seated there. So he told me that the medication, I was supposed to be given an injection, and that injection is not in the facility, so I have to go and buy it, then I come back. And also it will be better if I come back with the person I was with, so we can be treated together. So I did not have money to go and buy the medication. And it was on Friday, and that health center only operates Monday to Friday. And I was in a lot of pain. So no money. On Saturday they don't open. I don't have money to go maybe to the pharmacy to buy drugs. And this was something that was happening to me for the first time. I've never had an infection before. So I went back with that pain. If someone ever had a gonorrhea, you can understand or you can imagine how painful it is. And remember, you are a man. For you to now to decide to seek medical attention, maybe you have umevumilia for some time. So I had a friend online who we used to chat a lot. So in the evening, we started chatting, and this friend of mine noticed that there's something wrong. So he asked me, Ibrahim, you don't seem okay, what's wrong? So I told him I met someone online. We met, we had 1, 2, 3, and I'm not okay. And I went to the facility, nearest facility, but I was not able to get any help. And I don't have any money to buy medication. So he told me there's a place where I can refer you and you'll get help. So on Monday, let's meet, I'll take you somewhere. So very early in the morning, we met with my friend, whereby he took me to the swap clinic, whereby I was enrolled. I was given health services because I didn't know even how to use a condom. Or by then, I used to, there's this myth that I was going around, if you have sex with a fellow man, you cannot get infection, you cannot get HIV, all those things. So I was able to get given health education, and I was given medication. In fact, I was just given pills to take. There's no now injection. So I left, and I decided now to start going for services, health education, and it was just time like this. We were heading, it was in December, about close to December, because in the same month or few weeks, there was at least a World AIDS Day. So at least we were told there was a lot of activities going on. So since then, to cut the story short, there was a program that was happening then about PrEP back in 2015. So I was told if I could be interested to join the program. I joined the program. By then, PrEP was on demonstration study. So I joined the program back in 2015, and the study was going for 15 months. So because of the support that these programs are offering, I'm happy to stand here and say that I, Ibrahim, am the longest PrEP taker in Kenya, because since then up to now, I've been taking PrEP, and that's for the 9 good years. And at least I have had the platform now, at least I can tell my fellow community members how to protect themselves. And wherever I approach someone, at least I tell someone I am a living example. I've been taking PrEP for this long time, and it works. And I can tell here and tell you confidently that PrEP works. Because if it wasn't for PrEP, and if it wasn't for this program that are offering the services that has opened doors, they are not discriminating us. For example, if you go, for example, to access services, the clinician or the reception knows you by name, you feel like if you are home, you can go back again. But if you go somewhere where you are not given good services, you won't go back to that place. So I thank very much the program. And maybe I could just give maybe a suggestion, because if it wasn't for that peer educator, maybe I could have known this program that exists. So the peer educators who are at the ground, they should be more empowered at least, so that they can reach more people. They are the people at the grassroots. They know the challenges. They know the people who are out there. They are the ones that you can bring these people out there. Also, for the longest that I've been in the program, at least I've been able at least to get employment. At least I've been given a somewhere whereby now I have a platform where now I can talk to the community that I represent. I can welcome them. I can help those who are in denial. I can tell them about health services, how they can protect themselves, and so on. So mine is just to thank Ciheb and all the donors and the people who are supporting the communities for training at least healthcare workers who they do not discriminate us. As I said before, LGBT community, we are just people like any other. You are our fathers, you are our brothers, uncles. Maybe your father or your mother, or not mother, your father, your brother, your son might be an LGBT people. So those, don't push them, just embrace them, and maybe you'll learn anything. As I can send here, for example, when you go to the health facilities, we are not contentious. So when you are serving a community member, an LGBT, it's not going to infect you for you to come an LGBT. We are just people like any other one else, and we deserve better. So for healthcare providers, please learn from the programs that are serving this key population, and maybe you can make Kenya a better place to live. Thank you.
Thank you, Ibra. Thank you so much for that story. Very, very captivating, life changing to many. So before we close this session, I know it's taking a little bit of time, but if you allow me, ladies and gentlemen, I want to introduce you to a mother here. Okay, so this lady goes by the name Sarah Otieno. Okay, and she's been a beacon of hope to many women out there in our program. And Sarah, please, tuongeleshe kidogo. Thank you. Let's give her a clap again.
Thank you so very much for having given me the opportunity. I greet everyone. Good evening. Yeah, I'm Sarah Otieno from Migori. I'm a person living with HIV, stroke, AIDS disease. And I was diagnosed in 2021 while I was in Form 1. This pained me, but it really didn't pain me that much, just because I was once becoming so very sick, very oftenly being taken to the hospital, being told that I have a chest problem, every now and again, chest problem, but we never knew what was going on. Then one time, my grandmommy, whom I was left with, because I'm an orphan, since 1997, when my parents left me, so my grandmommy took care of me since then. One day she woke up and told me, Sarah, we need to go to the hospital. Let us go and test for HIV. There is something called HIV stroke AIDS. So we went, me and my cousin, whom we were staying with at home. After going to the hospital, I was diagnosed the very day, and the result came. After the result came, I just thank my God because I had been suffering back then. I thank my God because I had finally gotten the thing which was messing my life back then. I really thank God for that. And I really thank God for all our partners for having brought the program, for having bring the strength to those people who haven't the strength by then. I thank you, all of you. So back then when I was started on ARVs, I was encouraged to take my drugs well. So I continued, and my grandmommy decided to take me to a day school, not a boarding school. There in a day school, I had some challenges of going to work, doing what, so many things. Then she decided and told me, I can see you are not performing well, let me just take you to a boarding school. And I asked her, and how am I going to take my drugs in school? By then, I was taking a drug which was being taken twice in a day. That was TDF-3TC nevirapine in 2021, if I can recall. So the drugs were being taken twice in a day, and that became a big challenge to me in a boarding school. Since I was taking my drugs at 6 a.m. in the morning and 6 p.m. in the evening, this became a big challenge to me because after lunch, after dinner, we could go to classes. Sometimes I do forget my drugs. After time in boarding school, when the viral load were being taken, I was highly suppressed, very high, very high. So I never knew what viral load is. I never understood by that time. Though I was enrolled to some activities, some support group, but by then I didn't understand anything. Later on, I came and catch up and tried to take my drugs so very well, and this made me to disclose to even to my most closest friends so that they could help me take my drugs as usual when needed, when they were prescribed by the doctors. So my desk mate could help me each and every time, even if we were doing our exams. She could even wake up me up in the morning and ask, Sarah, have you taken your drugs? Then I could, oh, I've forgotten, let me just go and pick them. So I could rush to the dorm and take my drugs. And even when my TCA could come, that's where I started become so naive. I started become, I don't know, so tired. Because the TCA, for a person who is highly with the high viral load, this person could be given a TCA of a monthly basis TCAs. So this affected me. Why am I always going to the hospital each and every time? And even my classmate could even ask me, Sarah, kwa nini wewe unaendanga hosi kila mwezi? Unaendanga kuchukua nini? Mimi nilikuwa nikiwadanganya, I always go to pick my TB drugs. Because I didn't want to expose myself to each and everyone, but to just a friend of mine who was my really best friend. So with her, she could encourage me and could tell me, Sarah, you just take your drugs so well, you will live longer. And I decided to take her encouragement. Thereafter, after Form 4, I became now a girl in outside the world now. Friend, because even could even disturb my mind. How am I going to disclose? Could even disturb my mind. How am I going to disclose to this guy that I'm HIV positive? So I could even, because I didn't want people to say, oh, bona uko positive na utaki kudiambia, you see. But one day, one time, I met this guy. I met a guy, and this guy really loved me. So the guy, one day, one time, tukakosana tu na auntie yangu. We discussed with my auntie whom I was staying with, and my auntie, since she knew my status, she went and disclosed to this guy my status. This made me so bad. In fact, it really demoralized me, and even it made me not to took my drug for some time because I wanted to die. Because anytime, any point I could pass, people could just tell me, this person, you can imagine the way she is looking like. she's HIV positive. Everywhere. You can imagine you walking, people discussing about you, people discussing of what you are. It was really, really so painful. And what could not even motivate me, that my parents were not even there to encourage me. I didn't have anyone to encourage me by then. So I was so very much demoralized. Thereafter, I became a mother, very, very much pregnant. And I remember one day when I was told that when one is HIV positive, we can live with the HIV in our body, but give birth to a baby who is negative. This motivated me to take my drugs because I never wanted my kid to turn HIV negative, positive. I encouraged myself and I decided to take my drugs. And as per we are speaking today, I encourage Ciheb and I encourage all the partners, because for the education that I got, my babies, I have 2 kids, they are HIV negative, and I really thank you so very much. And even as we are speaking, and I'm even working with Ciheb-Kenya, helping me to put food on top of my table, at least we can eat, we can clothe. I thank you so very much. And then again, I also thank each and every person for the support. And I also encourage each and every person, let us all encourage each and every person who is living with HIV positive. This makes me feel bad whenever I get, even when adherence counselors, they could sit down and say, this child is very difficult. No, we are no longer difficult. It's just a stage in life which is making us to be difficult. But one day in time, they will come to understand gradually what is really happening and the importance of them having the HIV and importance of them taking the drugs, then they will adhere. Let's not give up on them. Let's help each and every person. I thank you all.
Piga makofi mazuri. A better hearty clap. Yeah, so we are moving a little bit faster because we are behind schedule. I want to bring on this podium the OTZ champions. Wapi makofi ya OTZ? Sawa kabisa. So they are going to present a song. Ni wimbo yao yenye they've recorded a song. Yeah, so, and I want to request you guys, ukisikia umebarikiwa, you can clap, you can dance. Daktari Patricia, najua utakaribia hapa, Let us give them support because these are our champions, They ensure that each and every young person mwenye anakuja in the clinic anapata the services. So mtasimama hapa please. Your screen. DJ, ukiwa tayari utustue.
Before the DJ plays a song. Good evening, everyone. Good evening, everyone. Good evening, everyone. It seems the mic doesn't want me to talk.
You can use.
Are we okay?
Check.
Are we okay? How many know OTZ? How many know OTZ? Zero missed? Zero missed? Dr. Katana, people are not. Zero missed? Zero missed?
Drugs.
And zero?
Viral load.
OTZ is the only initiative, I think, in the world that when you have a zero, you are cool, you're doing good, and you're doing a great job with your health. So clap for us. An initiative geared towards improving viral suppression and encouraging young people to achieve zero missed appointments, zero missed drugs, zero viral load. And that has been our motto. Some of us started in OTZ while we were so young, and now we have grown, and soon we are graduating to families, and hopefully our young ones are the ones who are going to come and stand here in front of you and speak about the success stories of their parents, coming from millions to zeros. So here, I have a very able team, but before I go to my team members, I forgot to introduce myself. My name is Damaris Nyamoya. I am the OTZ National President. So you are all privileged to be in the presence of Her Excellency. Yesterday we were with His Excellency. Unfortunately, he didn't want to shake my hand, but we will meet later. So right about now, I'd like to welcome the OTZ crew, comprising of artists, comprising of CEOs, mentors, advocates of PrEP, and U is equals to U champions. So welcome. DJ, you may do your thing. Ati si usema Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000. Yeah, si ndio hero.
Yeah, yeah. Yeah.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000. Yeah, si ndio hero. Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000. Yeah, si ndio hero.
Ngoma ni moto.
What?
Ngoma ni mboko ka wendo hero.
Juu mikono.
Najiwaita watonya kushinda happy.
Na vichwa vitasonga design ya kainesi.
Cheki msupa. Acha kununa.
Kidogo,
Kwa kila
DJ.
time unadunda.
Hello, hello.
Amwezi hatuwezi.
Hello, hello.
Hatutakaa hivi.
We can't sing and you guys are
Watu
just
wasimame.
seated. Surely,
Watu
surely.
wasimame. Let's warm up. Let's warm up.
Upstanding.
Let's warm up. Let's warm up.
Upstanding. Atawafunza.
When I say Operation 000, you say?
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000, yeah, si ndio. Sikiza.
Ngoma ni moto.
What?
Ngoma ni mboko ka wendo hero.
Juu mikono.
Najiwaita watonya kushinda happy na vichwa vitasonga
Design ya kaineti.
Cheki msupa. Acha kununa.
Hapana.
Jukwa club kila time unadunda.
Mbona?
Una roll, una hanga mabuda.
Ai.
Rada.
Sikiza number 10. DJ.
DJ, if you're ready, you are ready.
And then we are going to dance. You can clap, but we have the Operation 000 dance. So you do a 0.
Higher.
Let's go.
Let's go. Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000, yeah, si ndio hero.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000, yeah. Sikiza.
Ngoma ni moto.
What?
Ngoma ni mboko ka wendo hero.
Juu mikono.
Najiwaita watonya kushinda happy.
Na vichwa vitasonga design ya kainesi.
Cheki msupa. Acha kununa. Jukwa club kila time unadunda.
Say what?
Una roll, una hanga mabuda. Rada.
Young boy, usikuwe benten. As long as you take your meds, keep it 10 over 10. Viral load,
I tell you we're down.
get up, rise up, CD4.
Hero, rise up when it's down.
Huku.
Zero number, tunataka
Kunywa dawa tu, penda life yako. Ona doki mazepro, hii ni life yako. Hii ni confession, zero infection. Nimechill mazepro, no temptation. OTZ no form. Operation 000. Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000, yeah, si ndio hero. Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000.
Si ndio hero.
Operation 000, yeah, si ndio. Twende.
Chali ndio hero.
Operation 000, yeah, si ndio hero. Hashtag si ndio hero. 3 zeros make us the champions. Healthy choice.
So I want you guys to look at me and Ivan. We are going to the hospital. Let's go. I go to the doctor. I take my drugs. I go. Jana, I take my drugs. I go. Kolo. Operation 000. Operation 000. Operation 000. Operation 000, yeah. Operation 000. Operation 000. Operation 000. Operation 000, yeah.
Chali ndio figa.
Publicity.
Life poa, dream poa. Positivity. Kuroroa, unangoa, kuna
negativity.
Kuwa hero ndio poa, kuwa na ability.
Life you can find with you is equals to you.
We go against the last time.
Untransmittable is
I
our future.
I go to the doctor.
I take my drugs.
I go.
I go
take my drugs, I go to the lab, I go. Load Colo.
Operation Triple Zero.
Feed your hero.
Operation Triple Zero.
Feed your hero.
Operation Triple Zero.
Feed your hero.
Operation Triple Zero. Yeah,
Operation Triple Zero. Feed your hero. Operation Triple Zero. Feed your hero. Operation Triple Zero. Feed your hero. Operation Triple Zero. Yeah, feed your hero. Kuwata dawa
sio poa,
kukosa clinic
sio poa,
CG4 kuwa juu
ndio poa,
viral load kuwa low
ndio poa.
Sio hero.
I'm a hero.
Operation Triple Zero.
Hey. Asante sana, makofi yao tena ya juu.
Thank you so much. Thank you guys. We love you, we appreciate you.
Congratulations. Kwenda studio ni ngumu.
Thank you so much. We take you there. And this time I want to welcome our CEO once again, just to take us through just the key tenets of our strategic plan, which you are launching today, so that you can all see where we are going. So thank you so much. Can we clap for our
Waiting for the slides. Next slide, please. Yes. So as you've already had said a few times, Ciheb-Kenya is a non-governmental organization, and it's also not for profit. Actually, NGOs are not for profit. It's important that I say this, because after you've had Matthew and Becky talk about the billions, there might be concerns about, who is making what. We are a non-profit making organization, and we've talked a lot about our health system strengthening approach to program implementation. Really, our focus is on quality service, and the beneficiaries can bear to that. We preach quality, we mentor on quality, and I think CDC, if hopefully Jennifer can also bear us witness that really in implementing our aim is to make sure that Kenyans who are accessing care in our facilities, wherever we are, or even in the communities, access good care. We also believe in meaningful collaborations, and today you are here because you're partners with us. So just looking at our roots, as has already been said, really we would not be here without the University of Maryland, Baltimore. And that also means that we've been in this space a lot longer. Ciheb-Kenya might be 3 years old, but we've been in the HIV field for a very long time. Since 2004, when UMB first implemented under the AIDS Relief Program, most of these have been funded through CDC to 2020, when they then transitioned to Ciheb-Kenya, and now Ciheb-Kenya was able to competitively apply for these awards, and we were fortunate enough to win the current awards, which Dr. Wangusi has already talked about. Next slide. So in essence, for us to have a clear path forward, we are truly looking critically at what our strategic directives are. And our vision is transformative and sustainable solutions for healthy communities. And we truly want to talk this vision. In other words, really in whatever we do, are we talking transformation? Are we talking sustainability? And the beneficiaries have consistently talked about how important these attributes are in the programs, in the public health programs that are implemented. And our mission is improving lives by increasing access to innovative and responsive health interventions through health system strengthening, strategic partnerships, research, and education. And you know, the best teachers of innovation are actually the communities that we work with and the people that we meet on the ground. They understand the grounds better. And sometimes you think you know until you get to the communities and they teach you. And without them, really, we wouldn't be where we are. And we want to work closely with these communities, with the counties, with the populations to just make a difference and to implement innovative solutions. And I realize that communities are more resilient. We currently are conducting a polio survey in Tana River and Kitui. And with flooding in those regions, our initial response was to stop. And I mean, it's been amazing to see the county health management teams of Tana River show us how to do this and to reach the populations, because they've always consistently asked us, if you stop because of your safety, what happens to the communities that you are supposed to get that care to? And so these are our core values: stewardship. We truly want to act within, to treat the resources that we get properly. Collaboration, and we've talked about that recurrently. Inclusivity. And you know, we've had inclusivity in the people who work with us, inclusivity in the populations that we reached. And I'm glad that Ibrahim was able to come and articulate some of those. The stigma that face the people who nobody wants to talk about, who nobody wants to reach, and yet they suffer from those ailments and they're at risk. Some of these populations are at risk, several tens of times more at risk of infections, including HIV. Innovation and excellence. So those are our core values. Looking at our 5 strategic thrusts for these next 5 years, I should say that this strategic plan is for 2022-2023. So we're already on our second year. You know, as you've seen, there was an exponential growth. And in that exponential growth, some things took priority, and that was reaching the populations. But it's never too late to say we are aligned and to declare to the world so that you can hold us accountable. We debated about our first strategic plan. And you know, we felt maybe health, because it's broad. We are already in this space of immunization anyway. We are already doing a lot of surveillance. Why do we have to narrow down to HIV? But there's a lot of work to be done still in HIV. And after extensive collaboration, we felt that we want to continue to drive the HIV agenda in this country, to work with the Ministry of Health, to work with county governments, to increase awareness of new models for sustainability, establish centers of excellence, make contributions to science from Africa, and leverage on the cohorts that we have to attract more funding and new projects, even to test drugs. You know, when you think about injectables, I think, was it today or yesterday when someone talked about injectables now? You don't have to get treatment or to take a pill every day. You can now take an injection every month or even every 3 months. We want to be part of that science as Africa and to ready ourselves for the vaccine. We never give up. The University of Maryland has been working on this vaccine since the beginning. They've tested several cohorts, and we want to be part of that, even as we expand our portfolio in health. Our second strategic directive is around strategic partnerships and collaborations. We can't say this enough. We can't do this alone. Becky talked about 19 partners, sub-grantees that we are working with. We have several other partners who are aligned. I know we have NEFAC in the room, if I'm not wrong. We have several CBOs and CSOs who, you know, we want to partner with. So as an institution, we are going to design, or we've started the process of designing a partnership engagement strategy, and then prioritizing. We already have MOUs with the county governments and with many partners, and we want to make sure that we can hold ourselves to this. Actually, we even have an MOU with the Kenya School of Law. So it doesn't necessarily have to be in health. And the reason why we went into this partnership is gender-based violence. If you look at the gender-based violence cascade, the main problem is getting justice for those who are victims. And we are now partnering with KSL and we'll be able to get advocates in training to support that process, to complete that missing link in the care of GBV. Next slide. Our third pillar or strategic directive is to build a high-performing and delivery organization. An organization is an organization because of its people. Ciheb is here. The results you've seen, the resources that are awarded to us is because of the people who drive this institution. We are what we are because we have a very strong team. And that is why we put this in our strategic direction. And at this juncture, allow me to ask the Ciheb employees to stand up so that you can see, when I stand here, maybe I get more attention than I should. So allow me to ask the Ciheb employees from 10 counties, 12 counties actually, to stand up so that you may acknowledge their presence. You know, we've grown so fast. They are a large number. We have almost 800, thank you, have a seat. We have almost 800 employees. And so this is just a representation of those. They don't even, some of them don't even know each other. We've grown so fast, but wherever we are placed, we want to make sure that our employees see us as the organization to be in, to implement systems that keep them motivated and sufficiently engaged, and to feel a part of this institution. Next slide. The fourth strategic direction is really about sustainability and existence. And this is probably the one that keeps me awake at night. To develop an entrepreneurial culture to generate income. And I know many local organizations in this room are probably, this is where we struggle. Local organizations, CBOs, I see Andrew from HealthStrat, I know LVCT was around, I know Koki has also been having discussions about transitioning to local. It's what is, how do we stay? How do we make sure we are here, like AMREF, like Red Cross, like LVCT celebrated 20 years. It's in our strategic plan, and we're going to put in place strategic, LVCT is represented here by Patrick. We are going to make sure that we have a strategic blueprint document that enables us to work towards that. Next slide. And to monitor that. You know, when we developed this, we said one of the things that we wanted to do was to build CK towers. So I attended LVCT's 20-year celebration about 3 or so months ago, and they were also rolling out their third or so strategic plan. And they said that in their previous strategic plan, one of their goals was to have towers or LVCT building. And in that strategic plan that they were launching, they had building. And so we were really inspired, it's possible. And so we really want to be able to, and strategic plan number 5 is research. And Dr. Wanguzi talked through the last to have a few studies, short studies, but also one big NIH-funded grant. We have a few work that we are submitting. We know that UMB, we're working closely with UMB to really build this portfolio. And right now our cohorts might be around HIV/TB, but we are really building this beyond that so that truly we can establish an institution that can work with other research institutions, including KEMRI, who are represented here today. So these are our strategic directives. Next slide, please. And next slide. And I really want to say that we are where we are and we are going where we are because we are working with partners. We acknowledge all the partners from our donors. A special mention to PEPFAR CDC. CDC, our funding is probably 95% CDC currently. And so we really thank them for trusting us with these resources, and for the teams that are here that represent the people who fought for us. Because I know when those grants were won by Ciheb-Kenya, the concern was, but this is a local organization. But because of the relationship and that we've had for years, you knew that there were teams that could implement this and do this successfully. We have the county governments, and I know we'll be hearing, just take me back. It's important that we recognize the county governments. We have Kisumu County, we have Migori, and I know CCs are here. We have Nairobi. Nairobi actually is a special partner to us, and I'm happy CEC that you're here. We've had several years from UMB working with, actually it's probably the oldest partner that we've worked with as UMB and then Ciheb-Kenya. And we've seen Nairobi through the transitions, from the Nairobi City Council to then Nairobi City County, and then there was a brief stint at Nairobi NMS, Nairobi Metropolitan, and then now we are back. So, and we've stayed strong. Our services have never been compromised through these transitions, and I think it's because of a very strong leadership and a strong county health management team that is represented today by the CEC. We have Kitui, we have Makueni. Our governor was to be here from Makueni, but at last minute he was not able to be here, but he's represented here by the CEC and members of the CHMT. We have Machakos, we have, I've said Migori, Kisumu, and then we have the coast region through partnership with LVCT, where we're working in Kwale, Kilifi, Mombasa, and Taita Taveta. And more recently, through the vaccination program, we're working in Siaya, Tana River, and Kitui. So truly, one of our objectives was to have a countrywide footprint. And excited to say, by 5 years, I'm excited to say that CDC has granted us the FIA grant, the FIA funding, and we'll be collecting or conducting this in 47 counties. So we are very, very proud that we are able to achieve that. And then the many partners that we are working with as sub-grants, through sub-grants, and a special mention again of University of Maryland, Baltimore. Thank you, man, and convey our thanks to the president of the university. Finally, I just want to again, next slide, thank everybody for taking your time to come here on a Wednesday night. I've already mentioned most of these beneficiaries, but allow me to ask Kawama, now that I know that they're in the room. Kawama Consults worked with us developing this strategic plan. George, would you stand up and just, so that we can clap for you. Thank you very much. Oh yes, and Brian. Thank you very much for working with us on this document, and at every point for pushing us, because we thought we knew you're not in the health space, but you pushed us beyond limits. And you actually sent me an email the other day asking, how far are you in the implementation of the plan? I didn't respond, but thank you, because you're holding us accountable. Yeah. So thank you, team. That is our strategic plan, and we want to ask you to hold us accountable to the things that we have said we will do. Thank you.
Haya, makofi ya daktari mzuri tafadhali. We are live on Twitter. Tuko Twitter at Ciheb_Kenya. Unaweza ingia at Ciheb_Kenya, na the hashtag ni #Ciheb Strategic Plan Launch. Hiyo ni moja, hashtag Ciheb Strategic Plan Launch. Alafu pia kuna hashtag Healthy Communities. Ingia hapo Twitter, tweet and you retweet. Sini sawa? Let's rise on our feet. Tunataka kupokea wageni. There are speeches which are coming. Na zitakuwa brief speeches, eh? But me and my able MC, mzee wa nguvu, si daktari amesema ni 5-year strategic plan, eh? 5-year. So nataka tujifunze kucount, eh? Utafanya 1 2 1 2 1 2 1 2 1 2 3 1 2 3 1 2. Si amesema tuwa hold accountable. Sasa hii ndio tunaweka hiyo mambo vizuri. Uko tayari?
Okay, 20, yeah.
Are you ready?
I'm ready.
Uliza jirani, are you ready? Are you ready? Tunataka kucommission Ciheb waendelee na kazi mzuri eh? Can we do it? 3 go. 1 1 1 1 2 1 2 1 2 1 2 1 3 1 2 3 1 2 3 1 2 3 4. Louder. 1 2 3 4 5. 1 2 3. Clap for yourself as we sit down.
Thank you so much for that session, Bobby. So, ladies and gentlemen, I want us to switch gears now and listen to a few speeches from some of our guests that we invited tonight. And without much ado, I want us to start with one of our own. And this is the Global Director for Ciheb, who is also a board member of Ciheb-Kenya. And ladies and gentlemen, please help me in inviting Professor Man Charurat. Please come and give us a few words. Karibu sana.
That was a lot of dancing, right? As Dr. Emily know, I dance, but there have never been video of me dancing, right? So I know, in fact, that in Nigeria, there's probably a video. Now I have to add Nairobi, Kenya, to one of those videos of me dancing. So a lot of dancing. So I want to stand on existing protocol to recognize distinguished guests, friends, and colleagues. So many of you already know who I am. I'm with the University of Maryland School of Medicine. I'm also the Global Director for Ciheb. And on behalf of the University of Maryland, Baltimore, UMB, and President Bruce Gerald, I want to congratulate Ciheb-Kenya for the achievement that they have made so far, but also for creating and launching their own 5-year strategic plan. Thank you. So as many of you know, when UMB launched their global HIV program 20 years ago, and it was really 20 years ago because it was 20 years ago that I last saw Dr. Jennifer Gabriel at UMB, and 20 years we're still at it. So knowing that we knew that we have to build things to last, and one of those things that we're going to be doing was recognizing the people and the system that needs to be nurtured and led locally, and that's what we did. In 2010, we launched a local organization in Nigeria, and then in 2020, we also helped support launching 3 more, Kenya being one of the 3 in 2020. And I must say, across all of our different programs globally, truly the Kenya program, and I've said it again, that the Kenyan program truly led many of the innovations that reflect a lot of things that we do across the board in our other programs. So, the Kenya program has been known to be clinically, in terms of quality, one of our very best, as you can be seen today with the very high viral load suppression. And that high viral load suppression wasn't just in 2020, right? It was all the way from 2015, where we saw very high suppression rate, but also the innovation that Ciheb-Kenya has led in terms of the methadone-assisted treatment clinics, which have become the model not only for Kenya, but I can also truly say that working with CDC in Zambia, we're also adopting this model for Zambia, and that it will be the firstly launched within the next three months. And also the initiative that's being led are things like COVID vaccination, which is important, but also to recognize that Ciheb-Kenya is now a trusted partner with the government of Kenya, and working closely with CDC Kenya to be one of the first local organizations to do the population HIV impact assessment survey, KenFIA. So that's another accomplishment. But more recently, I also recognize that Ciheb-Kenya has accelerated greatly the partnership that have been built with the local county government. And that has also been something that our Nigeria program have also learned on how to work with government-to-government type interaction. Again, learning from what Kenya has done wonderfully with all the county representatives here today. But these accomplishments, I would say, would not be possible for many, many things, and we have to recognize these things. So first, I do have to recognize Dr. Emily Koech as the Chief Executive Officer. You know her very well. She is truly an inspired leader who empowers people effectively, and she is relentless, right? I think everyone can recognize that she is truly the right person and the right woman for the job. So certainly a round of applause for that. Secondly, I want to recognize the senior management team, but also the staff at Ciheb-Kenya, right? For your drive and strive to do more, to perform better, and to put quality at the top of your list. And for that, you should also be getting a round of applause. I also want to thank CDC and the US PEPFAR program for many, many years of support for the last 20 years. First as the University of Maryland program in Nigeria, and now as as UMB program in Kenya, but also Ciheb-Kenya program on its own. And that for you, I want to thank the US government representative as well. I also want to thank the implementing partner who are great collaborators and friends who share a common vision of fighting health inequities and social injustice. For you to be represented in this room with us is also a testament to the partnership that is so strong within the country of Kenya, and that for you, I would like to thank you as well. And then lastly, I think the gain that have been made in supporting the local partners is also very important, in that the investment in sustaining these local partnerships going forward. It is true that the gain have been made, but it also is fragile, right? And I know that the Kenya is near or at epidemic control for HIV, and so that sustaining partnership will need to be continued forge forward. And then lastly thank the representative from both the national and the county government in inviting everyone here to be part of your leading the solution to help improve the health for the people of Kenya. And to my Ciheb-Kenya family, having done this for so long, a little bit of parting word that, one cannot do this alone. So hopefully the strategic framework that have been created is the glue that you will help and work with each other and becomes the life force for improving the human condition for the people of Kenya and globally. And I look forward to seeing the next 5 years and what that looks like. Asante. Thank you.
Yeah, thank you once again. We can give a round of applause to Dr. Mann. Thank you so much for the kind remarks. So next on stage is a man of few words, but many actions. And he is the chairman of Ciheb-Kenya Board of Directors. So ladies and gentlemen, help me in inviting Dr. Henry Mutai. Karibu sana.
Good evening, everyone. Distinguished guests, ladies and gentlemen, it is my distinct pleasure to be here with you today. first, a disclaimer. If you see the program, you see many doctors there. I am not a medical doctor. I'm a lawyer by profession, so yeah, I just thought you should know that don't fall under that list. Before I start, allow me to introduce the board of Ciheb-Kenya, because for many of you, this might be the first time that you are getting to interact with them. We are not all here, but I shall introduce them. Man who has just spoken is one of our directors. You can stand up, wave to the people. We have FCPA Erastus Omolo. Thank you, Erastus. We have Dr. Evans Amkoye. We also have some who are following online, although I'm not sure, has Esther Masese come? No, she didn't. So we have Ms. Esther Masese. We have Dr. Louisa Petri, who's also with UMB. And we have Ms. Caroline Mwangi, who's also one of our latest to join the board. So we are a board of, oh yes, and Dr. Njeri Gitao, yes, who is also. Jerry, yes. So that is the able board of Ciheb-Kenya, and I am privileged to have been invited to chair this board in 2020 when the University of Maryland decided to register and establish this organization locally. So I will not say much because the evening has already gone on quite long. First, congratulations to the management, Dr. Emily Koech and all her senior management team, all the staff of Ciheb for their hard work in preparing this plan that is going to lead us for the next 5 years. As a board, I can say confidently that it contains our shared vision of where we want Ciheb to go and the role that it will play in the health sector over those 5 years in partnership with the county governments and national government, all the CSOs, all the communities that Ciheb-Kenya works in. We want to ensure that we are sustainable in the long run because, as Dr. Koech said, we do not want a situation to arise where after a few years we have no organization, the support has fallen away for all the people who rely on Ciheb-Kenya. So that is a key objective and goal of Ciheb. As a board, we also want to ensure that we embed those core values. I think the acronym for them is SKY, to make sure that as an institution, they are embedded so that we can retain the trust of our donors, CDC at the top, and all the other partners that we work with. You saw those numbers that were shared with you. That is a lot of money, and with a lot of money comes a lot of responsibility. We cannot afford to lose the trust of our partners. We must ensure that we are accountable for every single shilling or dollar that we receive. So as a board, we will support and provide oversight through the appropriate governance structures. You'll appreciate that over the last 3 years, it has taken us time to build up the board to the point where we have sufficient directors to actually put in place all the structures that are necessary for an organization such as this. We have a very highly qualified board with a diverse range of expertise. You saw that we are a non-governmental organization, so we have to comply with the local rules, one of which is that as a board of directors, our services are voluntary. So none of those people that you have seen that are identified receive even a shilling from the organization. All the work that we do is on a voluntary basis. So I'm very confident that we have the capacity as a board and as staff to deliver on our shared vision, to continue to support, to build a vibrant public health infrastructure that can provide the needs and for the needs and care of Kenyans right across the country, not just in the counties that we have started in, but all the others in the country. So with those few remarks, I just want to thank everyone who has come here for this launch. I actually feel as if we are launching Ciheb-Kenya itself as an organization, not just the strategic plan, because this is the first such event we have had where we've been able to invite all our partners, our stakeholders, to come and share with us in this joy that we feel today. So thank you very much. Dr. Emily, you have done a lot of work, and I think we can all see the fruits of your work and that of your team today. Thank you all, and have a good evening.
So much. Thank you so much. Thank you, Dr. Mutai. So next on stage is CDC Kenya, who, as you heard from the start, is our donor. And to represent it is none other than the director of Division of Global HIV and TB, Dr. Jennifer Gabriel. Karibu sana. Let's give her a clap as she comes.
Asante. Good evening, everyone. I'm also going to stand on the protocols of those who've given them before me, in part because I think we're amongst family and friends here as well. I am truly humbled and honored to be here and to be representing my team, who is also here with me to celebrate Ciheb and this great launch of their strategic plan. I have something, as Man mentioned, I have something in common with Ciheb, in that I also got my start at University of Maryland on Lombard Street there. But I can't say that I progressed quite as rapidly as Ciheb did, 1,000% growth. How amazing is that? I think we need to give a huge, huge clap. And just now, I was realizing when the last speaker spoke about how this was the first time everyone's gathered, it struck me that those 3 years that you started were during COVID as well. So what amazing ability to overcome the odds that you have done. Just incredible. So yesterday, as many of you know, we celebrated PEPFAR's 20th anniversary and are really reinvigorating the U.S. global response in countries such as Kenya to achieve the shared vision of HIV/AIDS pandemic control by 2030. And I'll have to stop for just a moment and again give the CEO, Emily, a shout out here, because PEPFAR ran into a little hiccup right before the event, the day before the event. And so at 2:30, the day before the event, I had to call Dr. Croach and ask her to kind of save the day to make sure that PEPFAR still looked good. And I'm not going to give the details because then we wouldn't look good. But just suffice to say that not only is she visionary, hardworking, dedicated, but she can also solve the small details in one phone call. And I want to give her a handout for that, for saving the day. But together, we're also strengthening sustainable public health systems. And you've heard that that's part of their strategic plan. And together with the government of Kenya and implementing partners such as Ciheb, we are really changing the trajectory of HIV and AIDS pandemic. And there's really no greater testimony to that we now have 1.3 million people on life-saving ARV treatment. And yes, we can clap, but we'll clap again in just a moment, because of those 1.3 million, Ciheb is supporting nearly 264,000 of those. So it's 20% of those on treatment here in Kenya that Ciheb is supporting. So a huge shout out to Ciheb there. Dr. Emily asked me to give a shout out and bear testimony to the quality, and fortunately that's right here in my remarks. It's really something CDC is enormously proud of for Ciheb is. Across the counties that Ciheb works, and Dr. Mann spoke about this, the viral suppression rate is 98%. That's higher than anywhere else across the Ciheb counties. And just really critical to making sure that people are living long, productive lives, and also that we're not transmitting the virus to others, and that we are reaching epidemic control. So amazing work there. Ciheb has also reported less than 5% mother-to-child transmission of HIV within the program. And most recently have provided leadership to make sure private facilities also share in the lessons of prevention of mother-to-child transmission. So incredible work there. I think we heard so well about the prevention work that they're doing. They've scaled up prevention work. We heard that from Rita and Cantwell and Ibrahim and Damaris and the OTC team and Sarah. Just incredible work that you're doing there with treatment. But I want to, even beyond HIV, Ciheb is doing just amazing work with the quality. And I want to read an unsolicited email I got from a colleague of mine in the Global Immunization Program. It says, "Hi, Jen. I'm not sure if you're aware, but we're working with Ciheb for implementing a serosurvey in Kitui and Tana River around the polio campaigns. This is a study about 450-ish kids, but does involve a fair amount of community work, including serial blood collection and polio vaccination. A few items to note. Ciheb's early infant diagnosis work has perhaps made a big difference in the training of lab tech in the field. We noticed that the dried blood spots were perfectly collected and packaged. I later learned that PEPFAR uses dry blood spots for early infant diagnosis and has led this expertise within Ciheb. Ciheb performed great in mobilizing the community and implementing the field work. This is in a way like the dry run with a small sample size for something like what was mentioned that I'll talk about in a moment, the population-based HIV impact assessment. I hope this will give you confidence in Ciheb and their ability to implement things on the ground and take on new challenges. I wish there were more partners like Ciheb. And then a lot has been spoken to about this. As one of CDC's largest and most strategic local partners, Ciheb has, over the past 3 years, received nearly $130 million from CDC, and that's inclusive of the $46 million in the current fiscal year. This funding envelope is reflective of the confidence that CDC has in Ciheb, and that to date, there has not been any audit queries on financial management of the CDC resources, which means you have the trust of your donor. As has been mentioned, when PEPFAR awarded $20 million to CDC-Kenya to conduct the fourth population-based HIV impact assessment, CANFIA, meant to establish the HIV epidemic control status of Kenya, it will really be an important survey. We look to Ciheb as a local partner to work in collaboration with the Ministry of Health to do this work, due to our confidence in them. And collaboratively, with MOH in the lead, Ciheb has already met the deadlines that we have set for them in a very, very complicated survey to be done. So we are meeting for the first time as TWGs week after next, and really we'll get a start to the survey. So a huge round of applause to Ciheb for the great work they're already doing there. And then it's already been mentioned that PEPFAR has really moved beyond the emergency plan, and now we're looking towards sustainability. And I think, you know, not only all the great work you've already heard about that Ciheb's doing with all the counties, but as a role model themselves of looking towards sustainability. As Amanda said, they, you know, University of Maryland, Baltimore really had the vision of this being Kenyan-led, Kenya-driven, and now Ciheb exists as a Kenyan organization. And so I think they're a great role model and really have the expertise to really walk the counties through that transition to be sustainable. We're often talking, though, with our partners, similar to Ciheb, about, you know, working themselves out of a job. We want to transition this program to the government of Kenya, where we really feel the HIV program belongs. But seeing the strategic plan, I have no doubt that Ciheb will do many other great things, and that, yes, they will always play an important role in the HIV program, but I see them moving into research, moving into different surveillance, moving to global immunization. So I see a very, very bright future with this strategic plan. So let me, again, just congratulate them as they launch their strategic plan. Well done.
Okay, once again, a round of applause to Dr. Jeff. Thank you, Dr. Gabriel, for those kind remarks. So, ladies and gentlemen, we'll now have our representation from the counties. And you heard from the previous presenters that Kisumu County was the latest county, and the county that we support to get the G2G grant. And please note, this is not the G2G oil, okay? Yes, but this is a G2G award for HIV services. So to start us off will be the CEC from Kisumu County, Dr. Geoffrey Ganda is here. Let's appreciate him. Please welcome Daktari. Thank you, the stage is yours.
Good evening, ladies and gentlemen. Yes, thank you very much. I'm truly honored to be standing in front of you today on behalf of my colleagues, the CECs who are here, and on behalf of counties. Let me appreciate Ciheb for the great work they've done in coming up with their first strategic plan that will guide us into the future. They are a fantastic organization who have been working with us for the last probably less than a year right now. Is it a year plus? I'd made a very nice speech to read, but after listening to all that they had said, I realized they had said everything that I wanted to say. But then they took me to a place that I really love. I really love being taken to a place where I speak about all things that I like to talk about, and not really what I was asked to speak about. And so I'm just going to talk about things that I think are important to us as counties as we move into this space. So we know counties really have many problems. And this is the same as all over the world. Resources are never enough. But in one form or the other, we have to be able to produce results. And I was recently sharing something about Rwanda to my colleagues in my WhatsApp group. That Rwanda was one of the few countries in Africa to attain the Millennium Development Goals. And yet they are one of the poorest countries in Africa by then, just coming from that genocide and all the problems that we had. And so looking at the vision that Ciheb has set for itself, it makes me very happy because it really aligns to what we are talking about. I see three words that make a lot of meaning to me. One is transformation, and two is community, and three is sustainable, because those are the things that we keep talking about, and it's not news, we've always been talking about them. The issue of integration is not new. If you are going to have something that is sustainable, then it has to be integrated. One time when I was made a chief officer in Migori, in Kisumu, let me talk about Kisumu because Migori is there, they might listen to me. And I went around to one of my facilities called Simba Upepo. And after the nurse took us around, she showed us some, I asked her what that room was for. She told me that room was for community health workers. And so I asked them what they were doing. She said she doesn't know. They come there and they write on a blackboard and then they go away. And then I said, this can't work. We have to make something different. And that's a story for another day, because from then on, my director is here, Fred Olwach, knows that we went and said that we have to integrate the community with the facilities. And we went on a long journey that totally transformed the landscape in Kisumu, where we had very low skilled birth deliveries, around 60-something% to 90% in less than 2 years. This is what transformation is. So transformation is not easy. It means that you have to take the bite, take the big bites, and get moving with them. Now the bad story is that recently, last month, I went to one of my facilities in Moroni. And so as I was being taken around, I found one of the corners of the facility. It was beautiful. It was all tiled. And then I asked, what's this? They told me this is the CCC. And then across the other side, just 2 rooms, there was a room which was cemented on the floor with potholes. You know what potholes are? When you have cement and you didn't do the cement well, then it creates some potholes. And then they told me that's where the clinical officer sits. And so there's a clinical officer this other side who does the CCC. And the clinical officer would sit the other side and runs the general clinic. And the one who runs the general clinic usually finishes his work in 1 or 2 hours and he disappears. And the one who runs the CCC clinic has to stay there for several hours because there are so many patients. I said, no, I think we need to integrate. I think we really need to integrate. And integration is not just a story. When I was younger, I was a medical superintendent, I'll not tell you where. I discussed about integration, and we had a very nice chat with our partners on how we were going to integrate the OPD. And so we agreed I was going to look for money to put up an OPD. And they had some money set aside to put up an OPD. But eventually, they decided they were going to put up the OPD separately. And I was telling one of my colleagues, and I'll not tell you who, it's something that has really embarrassed me to date. Because whenever I go back to that place, the CCC clinic is there, and the OPD clinic that I built is there. That was 7 years down the line. And yet when we sat around the table, we talked about integration. That yes, we need to integrate. But when the rubber met the road, it never really happened. So if we are going to transform, if we are really going to integrate, then you're going to make hard decisions. You're going to make decisions that sometimes might take you 2 steps back. Because if you want to walk together, they say if you want to go far, walk slowly. So you might find, especially us in government, we might find that we are moving slower than you. But if you don't walk with us on that path, then you might find yourself alone in front there. And like the clinic in Ciheb-Kenya, not Ciheb-Kenya, the one I talked about, the day you walk away, we will stare at it and say, what? These guys have gone. And so when these patients come over there, there will be no one to see them. And I'm a victim, but there I'm also a gynecologist. I tell people I've never prescribed ARVs for any mother, because there's always that group of people the other side who can be able to do it. So there's a lot that needs to be done, but it can be done. And seeing the kind of team that I've worked with, the second thing I was going to talk about was digitization, which is another thing that we have to do. I've loved working with the Ciheb. In fact, they took away Ngeno from me. We used to have our small coffees and discuss about how we were going to have the whole system digitized. Because digitizing facilities is nothing. You have to digitize systems. You have to digitize a whole community into the facility. I talked about this some time back when we were talking about cervical cancer screening, and I had a big problem with my national government colleagues. So I went back to Kisumu and I forced my partners that we have to do this. One partner took up, and we decided to do a community-based approach. And for the first time, we could say that this community has reached 70% cervical cancer screening. So in the next 2 weeks, that, you know, we got this idea from you. Because what they did in 3 national hospitals in this country, Nakuru, Mombasa, I did in 3 weeks in Kisumu, through a totally different approach, totally transformative. So I think we have the right team. We have the right team on the board. Ciheb is transformative. It is their vision. If they live according to their vision, we in the counties are willing to work with you, because the stars have aligned. The president, I had a chat with him the other day, and he told me something. He told me, you know, these ARVs, we have made them part of the UHC drug list, which means the commodities are going to come. But what he was not saying, thank you. You can clap for him. That's because when the president talks about it, that's a serious thing. But what he was not saying is that he has integrated that program. He has made HIV be part of the normal walk-in clinic that you will walk in and you'll be able to find. He has made the supply chain part of the whole system. And so if the top is already talking about this transformation, then who are we? The stars have aligned. We are all here at this time. So let's get it done. So congratulations again, Ciheb, and we will stand with you. We will work with you. We have been a great partner so far. And let's work together. As my teacher used to say, Professor Nyunya, let's walk into that mud, let's wade into that mud, and let's get out of it together. Then we will succeed. Asanteni sana.
Okay. Thank you so much, Waziri. I think the message is home. So mambo ni matatu hapa. 1, integration. 2, integration. Ya tatu, integration. To ensure we integrate HIV services. So next on the stage, you know we are in someone else's territory. Okay, this is Nairobi, and we have with us the CC for Health, Nairobi County. So ladies and gentlemen, please help me to welcome our one and own Susan Silantoi. Karibu sana waziri. Thank you, the floor is yours.
Good evening. Sorry, I'm not as tall as my counterpart from Kisumu. You'll bear with me. I stand on the protocol established. Good evening, everybody. Like the MC said, my name is Susan Silantoi. I'm the CEC for Health, Wellness, and Nutrition in Nairobi. Even before I start, I'd like to recognize members of my team who are here. I think I saw a few of them. Yes, there's the Chief Officer in charge of Public Health, that's Tom. That's our Director for Health Facilities, Dr. Koyo. Is there anyone else from Nairobi that I see? Amazing. Please, you'll introduce yourself as well. HIV program, great. So those are the members of my team who are here. First of all, I stand with great gratitude and as we recognize this milestone for Ciheb-Kenya, you have been great partners to Nairobi, like you mentioned. Ciheb is one of our biggest supporters. We started working with Ciheb in 2010 through, Kanjo, as you previously knew it, and now through Devolution, of course through NMS, and now we're here. Ciheb has spent almost 14 billion Kenya shillings on us, and you support about 76 of our 125 facilities. Which is quite a big number. It's almost more than half. You also employ for us 743 workers and about 367 volunteers and lay workers throughout the county. We just want to commend you for this remarkable achievement led by your able CEO, Dr. Emily. And we have seen your dedication in supporting all the work that we do as a county. And I'm confident that even as we launch this strategic plan, that there'll be more strategic collaborations that we will do together. I'm happy to hear that while your work is primarily in HIV, you're quite flexible in the support that you give us, even in other interventions that we have. And I think as a county, we're really committed towards just making sure that people's lives are actually better through the services that we give. The county has, in the last 1 year or so, in our administration, we've developed a couple of things. First, we've altered some of our governance structures, so you'll see that our level 5s are no longer run by medical superintendents. We actually have CEOs for all our level 5 facilities. That's your Mama Lucy, your Mbagathi, Pumwani, and Mutwini. And of course, we've strengthened our boards and made sure that they are actually capable of doing the governance that they are supposed to do. Some of the milestones that we've had in the county, Nairobi County as a county did not have a public ICU. So we set up our first public ICU at Mama Lucy earlier this year, and we're working towards having the next one at Mbagathi. Of course, we set up our neonatal ICU as well, which is in Mbagathi. And we Eye Hospital at Umoja 2 just a couple of weeks ago, which we're very proud of. And moving forward, we have a few more projects that we're working on, including setting up our standalone ENT, and also, of course, digitization, like my counterpart from Kisumu said. On the nutrition front, which we're working on quite keenly, we set up our school feeding program. Currently, we're feeding about 88,000 children as of the last school term. In January, we will feed 190,000 kids. And then thereafter, in about May, we will do all our children in all our public primary and ECD schools, which is one of our major achievements as a sector. And of course, we can stand here and talk about numbers and get lost in the statistics. But behind each and every intervention that we do as Nairobi County, as Ciheb, there's individuals whose lives are changed, and like those we have seen here today, like Rita, like Cantwell, like Ibra, or Sahib, as he likes to be called, like Sarah, like Damaris, who is our president of OTZ. And it is just good when we see the individuals behind the programs that we do, because it continues to remind us that we are stewards of the responsibility that we've been given. And I'm happy to see that that is one of your core values, which is also our core value in Nairobi. We are stewards with the responsibility that we've been given. And so, Ciheb, you have continued to show great commitment to being stewards and in giving people the dignity that they deserve through provision of healthcare. So once again, congratulations, and we hope that we're able to work more together even in our various interventions that we're doing as a county government. So congratulations once more. Oh, and I'm supposed to officially welcome you to Nairobi. Karibuni sana, this is our home. And for those who are visitors here, I hope you've gotten to enjoy some of our best resources, including our nightlife, which is actually something we're very proud of, and the national park as well. So once again, thank you and congratulations, Ciheb.
Thank you so much, Waziri. Let's appreciate Waziri once more. Asante, okay. If you won't go home with anything, there's the nightlife in Nairobi. Yeah, under the hands of Waziri. So, I don't know how many of you know that Siaya County was the first county ever to receive G2G funding from CDC. And today we are privileged to have the representation here. Can we clap for them? Okay. Yes, and with us we have the County Director for Health for Siaya County, Mr. Kennedy Oruenjo. Let's welcome him. A round of applause. Karibu sana.
Thank you. Colleagues and of course my seniors, I stand guided on the issue of protocols. I want to just not mention it like Rebecca mentioned. I think it was quite a mouthful. Yeah, so before I continue, I think I have a team from CI. I think, let me introduce them. Joshua, that is my EPI coordinator. And when I say a team from CI, I also include the CM program team. There's Milka there, and of course the other teams from CI. I know we also have some of the directors here from other counties that have not been introduced. I can see Kisumu, Oloch, Frederick, Migori. I also saw Dr. Mudama from, yeah, she's here. Thank you so much. I want to mention that Siaya, we are very happy and lucky to have partnered with Ciheb and continue partnering with Ciheb. And I want to mention that we partnered within the immunization program. And during the COVID-19 vaccination, Ciheb came in when we were at below 10%. We were at 8%. But then through the partnership and also working through good community entry, through the implementation period, and also enhancing on the aspect of community engagement, we were able to achieve above 50%. And we became the third best within the country. So I think we have to applaud that. And secondly, through the catch-up program, we were also able to, of course, get the survey done in Siaya. And when they were sharing with us the preliminary findings, it helped us even strengthen some of our internal systems. And one of the things that was coming out very clearly was that, of course, some of the healthcare workers were not really sure of what had been included in the EPI program. So we worked again with them. We are still working with them on, of course, capacity building of the healthcare workers, and not only the healthcare workers, including the community health promoters, in, of course, being able to sustain the immunization program and also to support the routine immunization program. And currently, as I speak, we are above 80% on immunization, and I think working with them moving forward, we'll be able to of course, achieve more and more. So I don't want really to say much, but I want to congratulate Ciheb, the Ciheb family, for, of course, coming up with this strategic plan. And as Siaya, we are committed that we are going to work with you towards achieving this wherever we are down there. Thank you so much.
Thank you once again for those kind words. Asante sana. So representing the Ministry of Health, we have with us the head of the National AIDS and STI Control Program. So ladies and gentlemen, please help me in inviting Dr. Rose Wafula. Tumpigie makofi anapokuja daktari. Okay, kwani tumechoka? Yeah, there's dinner after this, so please. Karibu sana daktari.
Good evening. Good evening. I hope you're well. Thank you for the invitation and congratulations, Ciheb. This is really good. As mentioned, my name is Dr. Rose Wafula. I'm the head of NASCOP. I just realized I'm representing the Ministry of Health, so I'll wear 2 hats. But I'm here alone. I hope I don't have any other NASCOP person here. But if there is, please stand up. I recognize you. Yeah, I know that my team is not here. Unfortunately, we are doing what we do best. So I would like to speak briefly on what NASCOP does. NASCOP is the ministry arm, the technical arm that is responsible for the HIV response in the country. And I'm here alone because my team is in Naivasha, trying to work with other partners to ensure that our supply chain is not disrupted by the floods, by the December holiday, and that next year, after Christmas, you continue having services. So they are not here because of that reason. I also almost missed. And yet I had confirmed I'm coming. I was busy working and I got a call. Daktari, where are you? I said, I'm in the office. I've just left the office and came here. Because I just had to come. For the simple reason that Ciheb is a friend to the Ministry of Health. Ciheb is a partner that is dependable. And similar to what Jennifer said, has come through for the program in many ways, both in innovation and in the routine programming. So as I say, congratulations, really, it's really from our heart, and for me, from a personal conviction that such partnerships can and need to be encouraged in this country. As head of NASCOP, I asked Emily to send me what she would like me to say. She told me she'll send it on my official email, which is not on the phone. So I don't have remarks that are written. So whatever I say is what has come from my heart. I want to speak briefly on the space we are in. I think this strategic planning, this plan that we have today, comes at a time when we've had a very long period of response. We have very good results. I'm not allowed to speak on the national numbers for the simple reason, while its day is on fast, I might just say the very thing that is on fast. So I might as well keep the numbers, welcome you to Meru. But yes, we do have great numbers that have come from close collaboration between the national program, the counties, and the partners. These results we celebrate, and I want to say that we are in a space globally and as a country where we are rethinking and we are reimagining the HIV response. We are rethinking because it's time we reflected on moving forward in a more strategic and organized way. And I want to reiterate what Dr. Ganda mentioned. Last year when we were in IAS, I do remember the community saying that beyond viral load suppression, why did we respond in public health? To give communities good health. And you can't have viral load suppression, but have other things that are emerging, cancer, hypertension. So how do you then move forward with a program that has over 1.3 million Kenyans, 60% who are over 45 years? You have to rethink, you have to reimagine. It is exactly the value of strategic planning, because it means reorganizing, resetting how you're doing your delivery of things, and using the same money to deliver what matters to the community and to the clients. So I really want to thank Ciheb, because looking at what they're proposing is really rethinking how to reposition not just themselves, but to respond to the Kenyan population. As a program, we are aligned to the government agenda of universal health coverage, which is aligned to what we are thinking as the new way of doing things. We've been asked to realign to the primary health care. So Dr. Ganda, there is no room today of a parallel CCC. So as we move forward, I'm happy that we are thinking about a holistic way of programming, being more adaptive to the community needs, being more adaptive to the type of population that we have. And I've seen that reflected in your plan. It is a whole person thinking now, moving forward. These young people we see here today in the next 10 years will be 35 years, will be 40 years, and their needs, we have to start planning for them now. I am equally happy for Ciheb, just like Jennifer said, because they've really grown within a very short time. Really, really. And I suspect that beside this being the first strategic plan, I think they have a very strong board and a strong team that really injects strategy, and it's the first time they're just writing it down for us to see. I think we would like to borrow that as we move forward, it's good for us to spell out what our intentions are and what we want to achieve together as a team. So congratulations to the board and the team that has worked with the team to have this plan together. I do think that aligning with the government agenda of sustainable programming, efficient programming, we can achieve much more in such a manner that is very organized and clearly stipulated. So on behalf of the ministry, as I've been instructed, I would like to congratulate you and just say that we have done 20 years where we have achieved much without thinking who should get the credit. I have seen situations where I call Emily and I just say, Emily, I need this done. And Emily will go out of her way, not by starting by asking, will you recognize me or not? I do believe this plan spells out why we should come together, and we are here to work with you, Emily and team, to deliver on this plan, and also invite you, as we have our plan of realigning with the UHC and PHC agenda, that we work together to achieve the best for Kenya. Congratulations and have a good evening.
Thank you, Daktari. Thank you for those remarks. So, representing the National Syndemic Diseases Control Council, Ruben Musundi, let's clap for him.
Ladies and gentlemen, good evening. My name is Ruben Musundi. I learned from Dr. Howard Mills, when you are sent to represent, you declare first. So I'm not the CEO, I'm representing the CEO NSDCC, and we are glad to be part of this. First of all, I want to start by congratulating Ciheb-Kenya for this great milestone. I've never met Dr. Koech, but I want to say congratulations for this achievement. When I came, I had certain asks to Ciheb, but when I've listened to your presentation, I'm sure that, as Dr. Rose has indicated, your plan is aligned to government policies and government guidelines, one of them being the CASF, the Kenya AIDS Strategy Framework. We did a midterm review of the Kenya AIDS Strategy Framework with the county teams, and we came up with the status of each county in terms of implementing our indicators both as a country and global commitments. And I believe the team I've seen here from Ciheb can really get us as a country. I have seen a resilient team here from Ciheb, and I know we'll build partnership, Dr. Koech, going forward to be able to achieve our country and survive. Multi-sectoral HIV prevention roadmap we developed in August and launched at the Maisha conference in Mombasa. For those who are there, this is an area, but I think with this plan we can be able to accelerate our efforts as a country to meet our target by 2027, which is a commitment by our country. I want to say within this program, as NSDCC, we have been running what we call the triple threat campaign, targeting adolescent girls and young women with the 3 areas of HIV prevention, teenage pregnancies, and sexual gender-based violence. We are working with the National Council of National Council of Population and Development, and we are working with the national government, the NGAO, the county governments, the communities, so that we are able to address this issue. And I'm happy, NSDCC, we are engaged in one of the areas, which is advocacy. And I want to report that we at NASCOP, we normally showcase what the country has done, especially in our key and vulnerable population, particularly on harm reduction. We have been able to host 8 countries Zambia were here in September, I think, around there, after a Maisha conference. Zimbabwe just visited last month. And I want you to clap for yourself, because what we showcase is what you do. We have people like Rita who come to showcase the results of our harm reduction program. And I want also to report that we have been able to bring on board our members of parliament who have started to understand our program, and we are working towards 2 areas. One is the policy environment, and number 2, the legal environment, and we are able to support the program going forward. So I'll invite Dr. Koech and team, when we are doing these reviews, you can come on board with the expertise to support us so that we push this program to be able to support our young people. So with this, I want to say, we are going for World AIDS Day, and we all know that globally we have let communities lead, and I have seen already here OTZ and other community members are already leading, but we know there are 3 areas we are encouraging: their participation in the decision planning. We are also talking about the area of support in terms of funding, and I'm happy that Ciheb is working on the area we had already thought about, HIV financing transition. The 5 counties you have worked with and they have ring-fenced the money or the funds will want maybe to move to another level where we have harm reduction through social contracting programs with the community. So that is some of the areas we need, because if we ring-fence the funds and they are not utilized, we realize they go to other services. So I want to congratulate Ciheb for being ahead of us in terms of supporting counties to allocate resources for programs in HIV response, but we want also to move ahead and empower communities in terms of resource allocation to be able to support our programs. Lastly, I want to mention that the area of barriers that are still hindering our programs, I was with Dr. Rose with the communities yesterday. We were looking at barriers in terms of HIV-related stigma, which is still a barrier, particularly Northeastern. HIV prevalence among the general population is lower, but HIV transmission from mother to child is the highest in those 3 counties. That is an area of concern for all of us, so that we can put our efforts together to be able to ensure that our children are born without HIV. So with that, I want to thank you and congratulate Ciheb once again for this great milestone. Thank you.
Thank you so much, sir. Thank you. So before I invite the final speaker for tonight, I just want to make an appeal. I know we are behind time. Please bear with us for a few minutes so that after the final speaker, we can unveil our strategic plan, and then you can be free to go. So, no. So that we can welcome you for dinner. Okay, so representing our chief guest, His Excellency the Governor for Makueni, we have the CEC Health, Dr. Paul Musila. Please help me in welcoming Waziri, who is representing our chief guest. Tumkaribishe our chief guest. Karibu sana daktari. Asante.
Good evening. I have to start by congratulating Ciheb, just in case in the process of talking I forget to do that. But then quickly recognize everybody who is in the house, the friends and leaders from the national government, partners, PEFA, CDC, Ciheb, and all the other partners in the house. My colleagues from the devolved governments, as the counties, have recognized my good friend from Migori, Kisumu, Nairobi, and all the other CHMT members from the counties. I stand in front of you wearing big shoes. My name is Dr. Paul Musila. His Excellency the Governor, Mutula Kilonzo Jr. was supposed to be standing where I'm standing right now and give his speech. So unfortunately, he got indisposed about an hour or so before the timeline for the evening. And he sent a message which had, I think, is it four or five words, and say Dr. Musila should take charge. When it happens that way, then you are left with no option. He did not send me his speech, so I have to represent him in that respect as well. And I have no doubt what he would have liked to say if he was standing here. Having worked with him since he gave me the opportunity to serve at the CCM for Health in November last year. This is 1 year now. And having also interacted with his manifesto before we got into office, I know that strategic partnerships is one of his key pillars that was captured in the manifesto. And we have gone on during the 1 year that we have been in office, 1 year plus, to actually appreciate the kind of support we get from partners. It actually feels very good when, as you sit in the department or in the county government as a leader, someone walks in and tells you, Daktari, Waziri, His Your Excellency the Governor, I have this amount of money and I have come to ask you, how would you want us to collaborate? You know, what are your priorities in the department, I mean in the sector of HIV, AIDS, or in any other sector? And sometimes you wish this person could actually walk into my own house and ask me the same question. Then we can now begin to discuss the personal issues that are there. But now, because of this is public service, then we quickly have to align ourselves to the same, policy guidelines that guide the public finances and sit down and develop programs. We appreciate the partnerships. In Makueni County, we are very strong on partnerships. I think at one time, I don't know whether the COG is represented here, one time kept on asking the partners, why Makueni? But we welcome partners. I got into the department as the head of Department of Health on November 8th, 2022. And within a very short time, I was actually dizzy because I had this number of partners, many of them walking in. And having come from the private sector, I can tell you some of the terminologies that were being mentioned in my own office and abbreviations, zilikuwa zinapita tu, were just passing. So I quickly decided that I need someone to assist me, coordinate these partners. And that's why I have someone like Dr. Mother seated here in the house. Many of you who are partners in Makueni, you have interacted with him. The 52 partners in the Department of Health in Makueni County. We quickly narrowed down to the sector of HIV/AIDS and appreciate the work that we have with the Ciheb, who is our main partner in that space of HIV/AIDS. And His Excellency talks about a few, quite a number of, activities that have happened with the interaction with the partners. But one thing that really makes him happy is the graduation ceremony that we had of the babies 2 years plus who were born of HIV positive mothers and were now graduating, all of them, 40 of them, negative of the virus. He keeps on mentioning this. And as a county government, we really appreciate the work that has happened in that space. We know we have some challenges in the same space of PMTCT. When I got into the county, I got to know that we actually had a rate of 10.9% as a pediatrician, because that is now my background, and that is what I have been doing for the last many years. I quickly gathered the team together and told them, no, this really is not acceptable, and if I finish the few years that I will be in this office and leave the figure as it is, I will have failed as a CEC, I will have failed as a pediatrician. And what I liked about the team, I think they are here in the house, George, Dr. Chalo, and the others. You quickly paused, and we were able to sit down with my team and ask ourselves, is really this the true picture? And then we engaged in an RRI. I think it has not been easy for everybody because the data has to be cleaned. And I'm happy that at the moment we are beginning to see where, probably some mistakes are happening. And moving forward, we will have credible, kind of data that we can quote, and also begin to see where the gaps are. That has already happened, and we are quickly closing. So this is work that, of course, is in collaboration with NASCOP, or rather spearheaded from all the way from the top, and we will endeavor. We undertake to execute it to the fullest, in terms of ensuring that all our newborns are actually free of of the virus. I will not talk into, I had an intention of talking into the vision, mission, but my friend Dr. Nganda has actually done that quite elaborately. But I like the core values, and I love collaboration specifically because we are able to sit together and actually redesign, if possible, or if necessary, redesign some, programs and see how we can best actualize, the activities ahead of us. We appreciate the launch we did, and His Excellency is actually the one who was there, present, to, launch the transition roadmap that we have branded Uzinduzi program in our county, and we really appreciate the G2G, the transition activities that we are doing. We have done one sub-county, Booni. We are quickly moving into the second sub-county, that is Kaiti, and we will soon be able now to integrate the services as has been said. It's the way to go, because we cannot have our clients tucked in a corner. Dr. Ndolo is in trouble, my chief officer, in one of the facilities. The CCC is actually just next to the mortuary, and clients have really been complaining about where it is placed in Makindu, level 4 hospital. So we have quickly, begin to think how we can do things differently. I will not say much other than appreciate the role that I have seen today the young people, play. Last year, during the World AIDS Day, we were really talking about the young people, worried about the triple threat. This year, again, in the next 2 days, the day after tomorrow, we will be meeting about World AIDS Day again, letting communities lead, and we still have the problem of the young people that we need to think about and actively engage, because if you communicate, if I try to communicate to a 16-year-old, a 17-year-old, I'll probably start thinking about placing big billboards on the wall, on the roadsides, and we all appreciate that they are not likely to see them. So we have to get ways in which they can actually be able to receive that message effectively. And that's why you saw some of us were not able to dance the song that was, we were challenged to dance. And the platforms, the social platforms, have to be utilized a little bit more, aggressively for us to be able to reach that young population. The messages have to reach even TikTok, and I think there might be other platforms beyond TikTok. Mi nimefika hapo tu. I don't think I can be able to interact. Even the small people in my house, they lose me when we are discussing some of these things. But we have to get there, and we appeal to the peer counselors and the other champions who are of that age group or at college level to assist us. And it's up to us actually as leaders to engage them and to involve them in these kind of activities to be able to win the battle. Otherwise, on behalf of His Excellency, I want to congratulate the team led by Dr. Emily Koech, Ciheb-Kenya, for the good job you have done and that you are continuing to do in the counties. And now I speak on behalf of all the counties, not just Makueni County, as you know, wearing the shoes of the chief guest. I appreciate the work that you are doing across the country, and I think you deserve a big clap from the audience. We wish you well, and we wish you great success, greater even than what you have achieved up to where we are. And I promise that as governments, both devolved and the national government, we will be available and we will be, we will participate to make sure that our goals are aligned, as Dr. Ganda said. And then, because we have one mission, a common goal that we have to accomplish, and we can only accomplish it if we work together. Again, I back to my favorite word, collaboration. Asanteni sana, and may God bless you. All the best in the implementation of the strategic program. Thank you.
Thank you so much. Let's appreciate him again. Thank you, Waziri. Thank you, Waziri, for the remarks. Our CEO, our chairman, Dr. Mutai, still with us. Thank you. Okay. Waziri? Okay. Yes. Okay. Let me also call Dr. Afula, Dr. Rose, to come and help us unveil this. Okay. Our colleagues from CDC. All right. And lastly, our CECs in the house. Okay. Professor Mann, please join the team. Okay. Okay. You can see they are ready. So, ladies and gentlemen, you are going to help them unveil. We are going to do a countdown. Remember, we are nearing the new year, where we do the countdown. So this one is for the unveiling of this plan. So you are going to help me do a countdown from 5. So we start from 5. Let's go together. 4, 3, 2, 1, 0. There you go. Rise on your feet. Haya, simama kwa miguu yako. Para pa 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 pa. Maisha mafupi ni siku. Chu. Ya nini niteseke roho? Ya nini niteseke? Jiunge nami upozeko. Shake a leg. Shake. Hey. I'm on the rock. Hey. And then I take a stop. I had to run like a fugitive. I'm gonna be to save the life I live. I'm gonna be iron like a lion in Zion. I'm gonna be iron like a lion in Zion. Iron lion Zion.
Thank you very, very much. This is our strategic plan model, and we are so proud that you're here to witness this occasion with us. We have, what is it called? QR code. So I'm sure there are many people here who would rather scan and have a soft copy, but allow me to just present a copy to you, our chief guest. Please take this to Rose. Oh. Oh. Three of them inside. Board, allow me to present the chair. I know you're the custodian of this, but and then to CDC, we thank you for your partnership.
Let's appreciate them more.
Yeah.
Ministry of Health, Dr. Rose Wafula, thank you very much. We have copy Dr. Ganda. Thank you for your wisdom. And I also have one copy for our CC from Migori. Thank you very much. Thank you very much, Oscar.
All right. Thank you so much. You can, yeah, we can appreciate them as they sit down. Okay, let's appreciate them more. Okay. So as you heard, we have the QR codes at the front. If you want to get access to the our strategic plan, you can just come and scan it. You can come with your smartphone and scan, and you are able to get the strategic plan. So as we do that, I want to welcome Dr. Caroline Ngeno, just to lead us on this session of cake to celebrate this special occasion. Okay, and thereafter we can close.
Thank you very much, Oscar, and thank you, everyone.
Yeah, before I realized we introduced the other county teams and we didn't introduce our own teams. So I want to introduce the team from Kisumu and Migori. Those are my teams also. Please stand up very quickly. Dr. Ojwang Lucy, is he still in? Chief Officer Migori. Dr. Oduor is in Migori. No, Dr. Ojwang Lucy is Chief Officer in Kisumu. Oduor is in Migori. And then who is this? This I don't know. Fred Oluoch is the Director Public Health in Kisumu. I saw Dr. Ogola, where is he? He left, stepped out, and him. You can introduce yourself? Okay, pleasure, asante. Huh? There's somebody else? Team Migori. Those are Tomodong, yes. Thank you.
Okay, thank you very much, Dr. Ganda, and thank you, everyone. I know we have really gone past time, so I'll just ask the program directors to come and help me in cutting the cake so that it can be distributed. So Dr. Becky, Dr. Anita, Dr. Sam, let me request you to come in front and help with the cake cutting. So on behalf of Matthew, I'll also give the closing remarks. It's really unfortunate that he could not be here today, but he really wished to be here. So I'd also like to recognize and really appreciate Matthew. Please, program directors, kindly, Dr. Charlo, Dr. Anita, tukuje tukate keki. So one of the things you'll always realize in events is that there'll always be cake cutting, but people rarely talk about the significance. So when you break bread together, it comes with a commitment. It comes with a commitment to stand together, a commitment to actualize that which you have done on that day. So today as we break bread, not just the cake, but even as we eat together, we can move it in front. But even as we eat together, we commit to walking this talk with Ciheb-Kenya. We commit to the partnerships and the strategic collaborations. So thank you very much. So let's all, where's the knife? Let's all hold hands. Dr. Emily, you are the utmost director. So we'd really appreciate if you could join us. Okay, in 1, 2, 3. Asanteni sana. Thank you. We can get plates and we go. Okay, thank you very much. So, in conclusion, I want to thank each and every one of you for being here today. Special thanks to the UMB family. Thank you so much, man. I know your flight was just 3 hours before this event started, and you've actually been able to make it. We really appreciate you taking that flight and even the long haul and all. We really appreciate that. I really want to thank the Ministry of Health, represented by Dr. Rose, both the devolved government and the national government, the CECs who are here today. Really what we do is because of your facilitation. I really want to thank our donors. I want to thank CDC. I want to thank all the partners that we've worked with together to just be able to actualize our vision. I want to thank the team that pushed us to putting this strategic plan together. Thank you so much, Kawama and team. The different meetings we had, the numerous times we spent just trying to concretize our thoughts. We really appreciate that clarity and guidance that you were able to get out of us. I want to thank the Ciheb family, the extended Ciheb family. When I say the extended, from the benefit in the programs, those who've come to represent the larger team, thank you so much. This is our organization. Matthew would have said, an organization does not have a mouth. You are the organization's mouthpiece. So we are all Ciheb-Kenya. And what Ciheb strategic plan becomes is what we are. It is what is within us, just to echo what Dr. Emily said. So thank you very much, everyone. So let us be upstanding for a word of prayer as we close. Oscar?
Okay. Thank you, Dr. Ngeno. So before we say the word of prayer, just 1 or 2 announcements. So want to invite you for dinner after the prayer on your immediate left when you get out. And before that, we also want to take the opportunity to recognize a few more counties who are with us here. Okay. So we have the County of Kitui. County of Kitui. Let's appreciate the County of Kitui. Okay. And that happens to be my county. Okay. Thank you so much for coming. And then we also okay. And then the County of Migori. I know they are recognized, but we have the CC, all right? We have the CC with us. Thank you so much for being with us. Okay. So, oh, yeah, sure. We have the County of Tana River, okay. I really don't know how we got here, but we are so happy. Thank you. That's resilience, yes. Okay. So once again, thank you so much, ladies and gentlemen. I know we went beyond time. Our apologies, but I think this was worth it. After here, we'll have dinner. Please check dinner. I know it's past time, but you'll have some 31 hour of drive home, so it won't be a problem, okay? Thank you so much. So let me call upon who is closing the word of prayer. Okay.
So let us pray. Father, I want to thank you for this moment. Even as we reflect of the Ciheb journey, we also reflect of how far you've brought us as individuals, as communities, as a nation, Jehovah Father. And I just want to place our strategic plan into your hands, oh God. Even as I pray for this nation, that you may bless it, that you may bless our leaders, that you may give us guidance. In Jesus' name we pray and believe.
Amen. Thank you so much. Have a good night. We'll have a quick photo session here for a few of us. Then you will need vouchers. You'll need vouchers. Okay. So, yeah. Sorry. Do what? So the photo session, we can have the photo session here. Okay. So our speakers for tonight. Okay.
TAFIC was a CDC-funded grant that was implemented over 5 years to support KEMRI as a platform for research and translation of research into implementation and practice.
Its main purpose was to strengthen public health and also surveillance for most common diseases, that is HIV, tuberculosis, and also to improve treatment generally.
It was a project that was funding programs that were being implemented jointly by CDC and KEMRI, and UMB role was to ensure that
Cameraman, please. Cameraman, kuja hapa kwa the launch. Cameraman, kuja hapa kwa strategic plan. Thanks for coming.
Nina siri na Yesu, yanifanya niwe jasiri. Kwa amani naye dhiki, yanifanya niwe jasiri. Yaniburudisha, nikirukaruka, Hosana amen. Yaniburudisha, nikirukaruka, nikimba, Hosana amen. Nina siri na Yesu, yanifanya niwe jasiri. Kwa amani naye Yaniburudisha, nikiruka
zake Bwana.
Mengi mazuri tumeyaona, Mungu umetenda, ni kweli wewe muweza. Ulitamka vitu vikawa, neno tulatosha, ukisema umetenda. Harisha Israeli, uliwavusha, kawatoa utumwani. Watumishi wako umewapa yote waombayo, ikiwa umependezwa.
Uamualo hakuna wa kulipinga, hakika wewe ni Mungu.